webinar is trying to indicate is that a child is actually bringing more than just a learning difficulty as a comorbidity, and it's across the board, because if we're just looking at learning difficulty, we are missing out on other well-being aspects as well. So the teacher's got to be basically all around, and it's the education of the teacher and the educator that needs to be kind of like looked at in the first place, and maybe bringing something in that they have an idea of, because a lot of the times they're just given, well, teach the kid, special kids, you got to be kind, considerate, you know, talk to them calmly, you know, your approach has got, it's an accommodation, okay, and a strategy,
Sure.
but not a style that is easier for the child. So that's worth a look. Sana, how are we placed for time? Are we all ready to kick off?
Well, time is already started, and I was just waiting if somebody else wants to join in. So right now we have 14 participants on board.
Okay.
So if you want to start, you can.
Oh, do you want to give it 3 minutes? Do you want to give it 3 minutes? So we start at 10 past. Do you want to do that?
Okay.
But yeah, I mean, just using the example of Italy, what are the sort of things, Leonora? You're in England. I mean, are you in the special educator field?
Well, I've worked in a mainstream school, and I was leading an inclusion room. So I worked with many children experiencing different learning disabilities, as well as autism. You know. Then I moved to the so I did this for many years in a primary setting. Then I moved to King's College Hospital. So I worked in a different field as a professional educator, but I was working in this ward where there were pediatric wards, where there were children going through a 3-month rehabilitation process after experiencing traumatic brain injuries caused by many different reasons. Then from there, so I was a multi-therapist assistant there, so doing therapy from the physio point therapy of view, speech and speech occupational therapy, all the 3 different specialties. So I was the only therapist working across the world with these skills. And then from that field, I moved to a private school setting now, or where I work as a well-being supervisor, because as you know, in England, since we have had the green paper and the new law, this was, I think, probably the first school, that's why I started to jump in, having a well-being supervisor. So I was given a white piece of paper saying, okay, I know you know the skills, because I worked as a clown therapist and many others, different things on voluntary way. And so they told me just change the school, do what children need to, just experience and blossom 360 degrees. So because they gave me this opportunity, I just jumped and left King's College just to try these new things, because in this field, as you know, there's so much to do and say, and it's very, very contemporary mindfulness. I have expertise in all these kind of fields. So I want to bring happiness in schools, but also possibly well-being. And this, so I have the responsibility for the staff, parents, children, so the whole
thing,
picture.
Dr. Khatija, I would like you to introduce yourself as well. I've seen your work and I was so amazed there in Malaysia when I saw you and working. And mashallah, you have got the honor of being Datuk as well.
Thank you.
It's amazing. And I'm so honored to be a friend of you. So please, if you introduce yourself.
Thank you for the compliment. Yeah, thank you. Anything for the children.
Definitely.
Hello.
Dr. Khatija is also the director of Spastic Center in Malaysia for the cerebral palsy children, and she's also working on autism spectrum disorders, and she's helping many people, and she's been went to international events, and mashallah, she will tell you that how much she has done.
Yeah. Basically, I'm with the Malaysian Rare Disorder Society, Rare Disease. And under our rare disease, we have all the various type of rare diseases. Yeah. And I work with the various other disorders. For example, autism, they have their own society. There's a national society, and there is also, they run schools and they have early intervention. And when we started, we have no information here. So I, get connected to the international Eurodis, European Union Rare Disease Society, and then also the Rare Disease International. I think you all should join the Rare Disease International. Then you have a lot of other policies, because they are going into, getting United Nations, United, recognition, universal health covers and all that sort of thing for the disabled. And we work with the Malaysian Council for Disability, remember. So because at the moment, everybody is lumped into disability. So this is sometimes where it's difficult to give individual attention to their, to help them with their progress or development, yeah. Because autism, we have a different spectrum, and then Down syndrome is something else. But and we have a Ministry of Education where they have a special education section. So now we have another one. It is under the autism, which is they are going to start. They are starting something new here on early intervention for autism and other diseases. So I hope you all can work together, Malaysia and Pakistan, on this sort of thing. Yeah. So this is something that I cherish to do, to share all this information. In fact, I have also informed the other autism parents to join, but I think because of the change of timing from the 6 to today, so that is something. But I will share. Thank you. I look forward to learn something from here.
We have just started now, and we will keep it ongoing. And Maria Vanilla, we have Maria Vanilla, the president of Project Isha. She is just like my sister. She is my family. This is Autism Casa is her, because of her as well. And she has pushed me also to start it with Italy. And I've started working with Italy, and now everybody says, "Oh, you have two homes now. You have Pakistan, you have Italy." So I have two families now, one here, one there. So she's a superwoman for me.
Thank you, Sana. You are the best. You are welcome in my family. 200 people welcome in my association. Thank you, Dr. Zahir. Thank you, Eleonora. Is my best friend. She lives in London City. Is a pedagogist. And I try next month, if possible, organize this training online on Italian language. Okay.
Yeah, I think it'll be a good idea. That.
Yeah, it is.
Very, very good training today.
Okay.
Il dottore è molto contento, Maria Pia diceva che è proprio un'ottima idea.
Yes.
I was just translate briefly.
Yes, and Eleonora will translate it. Oh, perfect. I got a translator. Brilliant. Just coming back to just coming back to what Dr. Khatija was saying, that what we need to understand with the disabilities is this, that a lot of the times we are segregating the different disabilities. Okay. like autism is like a different unit. Down syndrome is a different unit, okay? But when it comes to education, learning difficulties is not categorized into just for autism. That is something we need to remember, that it's not just there. Even people with Down syndrome have learning difficulties. They have sensory issues, which we don't recognize because they behave in a slightly different way and different manner, okay? Then it's like we miss that. That in autism, if it's given a diagnosis of autism, then we know that, okay, so autism, we research it, look it up, we're told, and everybody is like, no, okay, so you got to have a learning difficulty if you have autism, okay, and it's shown in school. But Down syndrome is not also looked at as having a learning difficulty, but they do. So I think if we're talking about education, this is just picking up on the point from Dr. Khadija, that when you're looking at different disabilities, when it comes to education, look at the fact that across the board, they are likely to have a learning difficulty, okay? And if we are looking at implementing, so don't implement just for autism or autistic children, or autistic individuals. I think we've got to look at implementing this sort of a style, whatever we do, across the whole disability sector, rather than just autism. And because learning difficulty is common across the whole thing.
True. And especially in schools everywhere. When I thought it is only in Pakistan that we are having so many problems, so many issues. But I've seen when I went to Malaysia and I went there, I saw there are lots of issues there. And awareness is everywhere. Then I went to Italy and I saw it over there as well. But if like today we are together, when we get together, we come to know how we all can cope up with different environments and with different issues. We learn together and from each other's issues having in those countries. It's amazing that we are going to have that here, and we will discuss. Inshallah, we will make a proper room here whenever we all like. I will post and I will share with all of you. Whenever you all would like to come and discuss on any topic, we will be here. What do you think? This is my idea.
Good idea. It depends on, again, with the guests we've got. If the questions are aimed for that person's speciality, then it becomes a lot easier. Because a lot of the times I have found that the questions they ask are sometimes out of my forte, and it's not easy to give them a good answer for it. So you're like skating round the information. So you're just giving a little bit of information that you are aware of.
So we have Sir Mahmood also here. We have so many participants, mashallah. And when we'll have Mr. Azhar Mahmood, Muhammad, can you please, and will you please introduce yourself as well? You're most welcome here.
Thank you very much, madam. I am the managing director and the principal of the Zamzam Autism Center in Pakistan. We are situated in Islamabad, and our center is in E11-2. The basic purpose of opening of this center about 3 years ago was to rehabilitate or make the adults, autism affected children, self-sustained in their adult life, because most of the centers in Islamabad are looking after the youngsters, that is up to primary level, class 10, 12. Throughout the Pakistan, almost that I know of. And then we have the aim to start a center where we can look after the adults and try and make a bigger vision that we can have a bigger center at one time, so that we can have living and the sustainable development for these children. That's all from my side, madam.
Thank you so much. So shall we start our presentation now, Mr. Zahir Ibrahim? I'm going to share the screen. Yeah. So everybody, you're welcome here for the webinar on specific learning difficulties in education in autism spectrum disorder. And we have here Mr. Zahir Ibrahim, and who have 15 years of experience with children of autism. And, yes, Mr. Ibrahim.
Hi, thank you, everybody. And thank you for joining in this webinar. Thank you, Sana, for arranging it and all the different, what you call it? Thank you for joining us. And hopefully the information we're gonna receive today or see today will enlighten us to move forward and for the betterment of the children. Okay, so what we're going to do today is this webinar. We're going to start off, this is part one. We're going to start off by looking firstly the relationship between specific learning disability and the autism spectrum. So in this field, we're going to look at the journey of specific learning difficulties, and we've got to go into what we call a flashback before we go forward and see what they really are like. So in this part one, we're going to look at the parents identifying that something is not quite right with their child, the school noticing that there's something not right with the child as well, how they go about getting the assessments for the children, the diagnosis that is given, the type of sensory orders, the crossovers in these disorders, the effect of the comorbidity, and what children bring along. So this is like the recognition of understanding what may be present in order to, as I was saying earlier on, in order to recognize the type of strategies, accommodations, interventions that are likely to be needed to bring out the potential of these children. Can we have the next slide, please? Next slide, Sana. Okay. So first things first, it's the parent who recognizes that there is something not quite right with the child. They see the child is developing differently when they're comparing it to other children of similar age, or the guidelines, the development guidelines that they are aware of. They find that the child development milestone is behind. Behavior milestones are not the same when compared to the other children. Language milestones are not the same. The child is still behind. The child may have and may show other issues as well, like sensory issues, sensitivity to light, noise, touch, smell, food aversions. The child may have coordination issues like fine motor skills, gross motor skills. The child is poor and clumsy, banging into things, which is often seen, tripping over things, and postural problems. They're not quite there. So again, the parent is recognizing that there's something not quite right. The child can be hyperactive compared to the other children or other siblings, not sitting in one place, climbing, jumping, which may seem a bit abnormal. Child may have sleeping problems. Again, child needs their sleep, but this child is awake for lengthy time. So something is not quite right. And these are just some of the differences. I've just picked on a handful because there are a lot more than that. But if I did that, then I think the whole PPT would just be on the differences that the parent notices. Can we have the next slide, please, Sam? So this was parents recognizing that something is a bit different about their child. And this differences are starting to be seen in school as well. So education is a good place where they start to recognize and see that there is something not quite right with the child. And that arises from a teaching point of view. The child is struggling with reading, writing, spelling, difficulty with words and sounds, writing and language are not age appropriate. So he's falling behind his peer group. He cannot fathom maths and language concepts. Attention and focus is very poor. Fidgets and disturbs others and doesn't listen to instructions. The work performance is below average, yet verbally the child is brilliant. So basically it's coming from there onto paper, he can't do it. The child is obviously behind in peer group, and child is different to the peer group. So the behavior, the sort of ability to understand, ability to talk, ability to communicate, ability to mix with people is not quite the same that would be expected for that particular age group in the milestones that everybody is aware of. So the school, and importantly the teacher, is recognizing that this child is a bit different. Something is not quite right. The parent did it, now that the teacher's doing it, saying something is not right with the child. Can we have the next slide, please? So after eventually recognizing, and the teacher, who's very good, battling with the school, saying, no, something's got to be done about this child, then the school decides to take some action. And they send the child to the school psychologist for determination, what is the problem? The psychologist will conduct relevant tests which are appropriately accepted by the education foundations in the different countries. Okay, the basic tests are along the lines of perception test and memory test, cognition and language ability test, attention test, intelligence and academic test, social interaction and aptitude test. So this is just a handful of basic areas that they'll start to look at in order to get an idea what is the problem or where the problem lies. And then they've got to determine what is happening, and that comes from the scores that the child has obtained from the test. So the test scores determine what area of disability that child is falling into. And there are four types, basic four types. One is development delay, classified as normal learning difficulty, below average, or the child is gifted. So the scores that are obtained in the test will determine the type of disability the child has got that is recognized by the education department of that particular country. Okay, can we have the next slide, please? Now the school has done their bit to determine what the child is going through, what difficulty is having, and what they have got in front of them. The parent then decides, with sort of consultation with their friend, their auntie, whatever, to decide, no, we must do something about my child is not quite right. I have to do something about it. And then they seek an opinion. So normally it's a medically related opinion that they seek. And the only person that is sort of in a better position to do so, that's a pediatric neurologist. So they make an appointment and they go to the neurologist, and the neurologist then conducts the tests on the child using the appropriate tools that they have been trained in to diagnose. They also work with the symptoms and traits that are described. So the parents are given like a history and a background to why they have brought the child to the neurologist.
एक तो ये नीचे बड़ी स्क्रीन बनी है, यहाँ प्लस माइनस लिखा हुआ है.
Sorry.
Okay, behavior is observed. So they observe the child, they do the tests, and the results obtained, again, just like the teachers did, they start to form a diagnosis. And in a lot of cases, they come back with a diagnosis of autism spectrum disorder, ASD. A lot of the time we're aware of ASD. So what is it? It is a brain development condition affecting how a person perceives, socializes with others, problems in social interaction and connection, limited and repetitive patterns of behavior that can affect learning. So this is the enveloped definition of ASD. These are the areas that it affects the child. Now, ASD they've given is it's an open diagnosis, but we don't know what it is. So we now need to know what are autistic spectrum disorders. Okay. So they are a group of disorders affecting learning ability. ASD affects learning ability. They are spectrum disorders ranging from mild to severe. They are cognitive or sensory based. So they are now groups. They are now in groups. So we got disorders that affect the child's learning ability, but those disorders can be cognitive or sensory related. The cognitive disorders, so that's like brain related, are dyslexia, ADHD, auditory processing, dysgraphia, dyscalculia, and visual processing. Sensory-based disorders are dyspraxia, which is a development coordination disorder, sensory integration, anxiety. So there are cognitive-based disorders and sensory-based disorders. So now ASD, we've kind of like defined it a little bit to say, okay, so they're sensory-based and cognitive-based. And these sensory-based and cognitive-based come under the umbrella name of specific learning disability. So specific learning disability now is made up of sensory-based disorders and cognitive-based disorders. And that's from the diagnosis that the parent has received from the neurologist. Okay. Go on to the next slide, Simon. If we see the picture on the left-hand side of the autistic spectrum disorder, the umbrella name, and that's what it is, it's an umbrella name. But if we have a look at it, ASD, autistic spectrum disorder, there are quite a few disorders recognized in that group. So when they give a diagnosis of ASD, what is it? Okay, because each one, the traits are very different, symptoms are very different. Okay. So from here, we can recognize now that it's quite confusing. What is autistic spectrum disorder? Because now suddenly we are told that it's made up of all these disorders. So let's define it. It's a disorder that interferes with students' ability to listen, think, speak, write, spell, or do mathematics. So this is common across all the disorders, that they will have some of these difficulties present there. So what are the signs? Signs are persistent difficulty in reading, writing, arithmetic, inaccurate or slow and effortful reading and writing, poor written expression that lacks clarity, difficulty remembering number facts, inaccurate mathematic reasoning. So these are specific learning difficulties and the signs, and the prevalence of this is across the entire autistic spectrum that we see in the picture on the left. There are different disorders, but the common thing they have with each other is that they have a learning difficulty. Next slide, please. So we talked about sensory-based disorders. And here the diagram shows it quite nicely. So what are sensory-based disorders? Sensory-based disorders are a group of neurological disorders affecting the brain's ability to use information received via the senses to function smoothly in daily life. So senses being sight, hearing, touch, smell. So these are like sensory things. And from this, we receive signals, and then it's translated. Now, the information we receive via our senses is affected in 3 recognized ways. One is sensory modulation that we see at the first left-hand side of the diagram. And here we see a person can be under-responsive, sensory craving, sensory over-responsive. So the sensory modulation is often seen, and we see that in autism, or recognizing autism, that they are sensory seekers, they have sensory issues. So this is an area. So they could be low, high on here. Then we have sensory discrimination disorder, where you have the visual, auditory, smell, positioning, vestibular, tactile, interoception that affects them there. Then we have sensory-based motor disorder, which is the right one on the right-hand side of the picture. And we see that in dyspraxia, often seen development coordination disorder, unable to catch a ball, unable to walk in a straight line. So dyspraxia is a motor-based disorder. And sometimes kids have different postures. So the posture is also a sensory-based thing. Next picture, please. So we saw the different types of sensory-based. Now we got cognitive-based disorders. Cognitive-based disorders affect the ability of individual as well as the learning, memory, perception, problem solving, behavior. So these are the key areas that cognitive disorders affect. And we've seen earlier on, we mentioned already that we got dyslexia in there, dysgraphia, dyscalculia. Auditory and visual are on this borderline where they go into sensory and cognitive as well. And we have ADHD. So they affect learning, memory, perception, problem solving, behavior. So now we're starting to get a picture of what we have seen happening in the classroom. Hopefully it will do that, because now this is starting to sort of make it easier to start to understand what we are seeing and recognizing in the classroom. Next picture, please. Now, if we look at the picture on the left-hand side of the slide, where we're now starting to see that there are overlapping happening between the disorders that we have seen. So this is now representing specific learning disorders. We already know that they are sensory and cognitive based. They co-occur with each other, and they affect learning. So these are the 3 key points of specific learning disorders at the moment, that this is what they do. Now, I've broken it down a little bit. So most commonly found are dyslexia, which is cognitive, dysgraphia, cognitive, dyscalculia, as we see, is cognitive, ADHD, cognitive, dyspraxia, sensory. Now, these disorders also have their attributes. Okay, so they're just not disorders co-occurring and affect each other and affect learning. They are attributes as well. They are all spectrum disorders. So that's the first thing we need to remember. The learning disorders are spectrum disorders, ranging from mild to severe. They cross over with one another. There is comorbidity between the disorders and give rise to different traits observed. So the combinations are different. The disorders are different, but they affect each child differently because they range from mild to severe. So depending which one is mild and which one's severe, or they're both mild. So you have like a different mix, a bit like making a curry. If you add spice A, it'll be hotter. If you add spice turmeric, for example, then it'll be more yellowy. So it's things like that. So the ideology is very similar. That's how learning disorders are as well. That, you know, depending which combination is higher or lower, it affects the child in that way. So we look at point number 3, comorbidity between specific learning disorders give rise to different traits observed. So this is the combination I was talking about. But importantly, the thing to remember here as well is that away from learning disorders that they are together with, comorbid with, they are also comorbid with other disorders, medical conditions too. So it's not just singular or related to learning difficulties, they are also medically inclined as well. Like neurological, medical, psychiatric disorders may be connected with this too. So it's a bit more than just a learning difficulty. So the picture is now starting to broaden a little bit, where we're saying, hang on a minute, it's not quite learning disorder. There might be something else attached to it as well. Can we have the next picture, please, Sana? In the previous slide, we talked about crossovers of the disorders, and the diagram on the left indicates that. Okay, so if we look at the diagram carefully, we've got dyslexia, ADHD, dyspraxia, and the autistic spectrum disorders. Each one has its own unique traits, but when they cross over, we see something different. So crossovers give rise to different traits observed. So for example, dyslexia was difficulty with reading, writing, spelling, word recognition, and sequencing. And ADHD was impulsive temper outbursts, hyperactivity, low frustration threshold. But the combination of the two is showing lack of concentration, distractibility. That's the different trait that's observed, but the underlying problem could be something else. The trait observed acts as a masking disorder. So when we see lack of concentration, distractibility, it could be any of the things, because that's what we see, but the underlying problem is something else. So it's masking the disorder. So here's the example: dyslexia plus ADHD equals lack of concentration and distractibility. That's what we see. But it's masking difficulty reading, writing, or low frustration threshold and temper, for example, or impulsive outbursts. So it's showing something totally different. So here in the classroom, further observations need to be made. So we're saying here, further observe for traits displayed as to possible disorders present. So now it comes to the teacher to start to recognize, okay, so we saw this, but what could it be? Could it be this or that? And then start to sort of monitor the child. The outstanding traits displayed is start point of teachers' strategies to be used. That's the point I've just made. Further traits may show up later. So at the moment they're showing this, and then a little bit down the line it's showing something different. So the teaching strategy for the child may need to be modified from singular to multisensory teaching strategy. So it's not a one shoe fit all. We got to like chop and change as we move along. Okay, so once we start to recognize that the child is showing these sort of traits and symptoms, then maybe we need to employ this strategy in which might work better, but be prepared to constantly chop and change the strategy a little bit so that you're tweaking it as we go along for the benefit of the child. Next slide, please. Next slide, please. Thank you. So we're seeing it's the crossovers, we're seeing the sensory and cognitive based. But what is the impact of specific learning disabilities? What are the effects of it in actually seeing in the classroom? We see that the overall education performance of the individual learning and their well-being is affected. It affects how auditory and visual information is received, decoded, and processed by the brain. So specific learning difficulties are impacting all this. Communication, speech, and language, both spoken and written, is affected. Memory, retention, and recall of the child is also affected. Coordination, catching, walking, being able to tie the buttons up is also affected, which are the gross motor and fine motor skills. Behavior comes into play. Behavior is affected, be it repetitive or inattentive, hyperactive or aggressive. The executive functioning and multitasking and time management by the individual is affected too. So it is starting to have an impact on the day-to-day running, on things that are needed to excel in education. Either you're reading and writing, but being able to absorb the information, being able to retain it, review it, able to multitask. So these are now starting to have an impact. So specific learning difficulties aren't just affecting education, they are impacting other aspects of it as well. Can we have the next slide, please? Okay. So earlier on, we had talked about comorbidities in learning difficulties. Okay. So if we see the first diagram on the left, which is comorbidity, some are visible and some are hidden. So if we see the middle picture, so the comorbidities and the effects of that are visible and non-visible. They were saying individuals with specific learning disabilities can have other comorbid conditions and disorders present in them that can be visible or hidden, and they can also impact on the mental and physical well-being of the individual. As we see here in the center diagram, a hidden disability, sleeping disorders, mood swings, anxiety. Hello, can you hear me? Hello?
Yes, we can.
Okay, perfect.
Yes, yes, we can.
Okay, perfect. So these visible and hidden disabilities affect the individual at different levels. If we go on to the right-hand side, we see that they affect academic level. At the academic level, specific learning disabilities affect learning. Okay. At behavior level, you got language delay, hyperactivity, sleep problems, aggression. At a psychiatric level, you've got autistic spectrum, other autistic spectrum disorders, anxiety, ADHD, self-injury. Neuropsychological level, dual tasking, attention switching, memory recall, cognitive flexibility are all affected. At a psychosocial level, they're affected too. The self-esteem, confidence, parental stress, relationship difficulties. They might even have medical conditions attached as well, like epilepsy, immune dysfunction, gut disorders could be present too. So on top of just learning difficulties, they're affected at the academic level, neuropsychological level, psychiatric level, psychosocial level. And a lot of the times we see, these are recognized. So a lot of the times we see the psychosocial level that the child is low self-esteem, is not confident, you know, but we need to recognize that. But the problem, again, just like everything else, what is seen, the problem could lie somewhere else. So as a teacher, as a professional, we need to look at a little bit beyond the box. Looking beyond the box might hold the answers that we're not finding by looking inside the box. Let's go to the next slide, please. Okay, so what we've talked about so far, the key points are in this slide. So if we look at the diagram on the right, where we've got learning difficulties, but a lot of other things come together with it. Okay? So children can bring along with them to school more than just learning difficulty, which is what we've said. So reading, writing is just one part of it. Attention deficits, as shown in the diagram. Different intelligence ability, IQs, they bring along that. Mental health issues, behavior, depression, we need to recognize this. Medical issues they could bring along as well, and social issues. So the diagram is just highlighting the key points that a child could be bringing along with them. And for that, we need to, as a teacher, we need to recognize and look at it, because it's affecting the child in so many ways. So in summary of the key facts, key points, autistic spectrum disorder, and in particular specific learning disability / difficulty, play a pivotal role in education. And in part one, I've got a summary of specific learning difficulty. Yeah. They are commonly found in autistic spectrum disorders. They are spectrum disorders ranging from mild to severe. They are comorbid with one another. Importantly, they affect each individual differently, and they cross over with one another in different combinations. So they're comorbid, cross over differently, and affect each other differently. Next slide, please. Next slide, please, Anna. No, before that. Slide 17. Okay. So we talked about the history, the background, what kids could be bringing along into education, and we highlighted specific learning difficulty, disability as having a major impact in education. Okay. So what we need to know is, what are these specific learning disorders that are playing such a pivotal role in the education or life of the individual? So we're now going to come into part two, which we're now going to look at what are they. So in part two, we're going to look at what are specific learning disorders as per DSM-5, the characteristics of specific learning disorders, classification, IQ classification, impact of the disorders in education, social, and employment, types of specific learning disorders, their symptoms, traits, and prevalence, some research facts, and importantly, at the end, what students that I have met have kind of said and mentioned what they would like to see and the support. So if we go on to the next slide, please. So what are specific learning disorders as per DSM-5? The definition as per DSM-5 is that it's a type of neurodevelopment disorder that impedes a person's ability to learn and use specific academic skills such as reading, writing, arithmetic, which serve as the foundation for most academic learning. So DSM is describing that that's what it is, that they affect reading, writing, academic skills in particular. So we've seen earlier, specific learning disorders affect the way in which information is learned and processed. Commonly found in autistic spectrum disorder, we've known that from part 1. Have impact on education, we know that. Occurs independently of intelligence. And this is a crucial point. It runs in families. So learning difficulties are not necessarily just with one person in the family. There could be other people in the family who may be affected too. So it runs in families. Come to the next slide, please, son. Okay. So what are learning disabilities? If we look at the red part of the umbrella, it's a number of disorders which may affect acquisition, organization, retention, understanding, or use of verbal and non-verbal information. They can cause impairments in one or more processes related to perceiving, thinking, remembering, or learning, such as language processing, phonological processing, visual spatial processing, perceptual motor integration, memory and attention, executive functions. On the language side of things, it's affecting oral language, like listening, speaking, understanding, reading, decoding, phonetic knowledge, written language, mathematics, computation, organization, and social skills. So the impact of learning disabilities is also affecting here. Next slide, please, Sam. So as we mentioned in the DSM-5 slide, specific learning disability does not affect intelligence. It affects IQ level, but not intelligence. High intelligence level person can still have issues with reading, writing, spelling, and math. Next slide, please. Okay. So we talked about specific learning difficulties and the IQ classification. So we see that in specific learning difficulty, the the psychologist done the test on the child, and we saw that they classified them per results into whether it's a development delay, below average, normal, gifted. Okay. So when they look to classify what sort of disability is present, then they look at the scores. So anything that's below 70 is classified as a development delay. IQ between 70 and 85 is classified as below average. IQ of 86 to 115 classed as normal. IQ of 116 and above is classified as gifted. Each individual, we've got to treat each person and their needs individually. So again, one fit strategy doesn't always necessarily be the best for every child. So when we see a development delayed child has limited communication skills, reduced ability to learn new skills, they need more support in daily things to do. Below average person needs more support, but benefits from a one-to-one care and classroom accommodations. In a normal learning difficulty, requires little support, classroom accommodations. A gifted person requires only some accommodation. So they don't require a lot of help, but they just need enough to push them along. Next slide, please, Hannah. So we see that specific learning difficulties have an impact on education. Not only that, but they can have an impact on social and employment too. So the picture is much broader. So it's not just education and that's it and everything is fixed there. It may not be. It moves on to other parts as well. So if we look at the diagram on the left again, common characteristics between the disorders, which is the bit in the middle. We know it impacts the individual differently. Comorbid with other disorders. But importantly, coping with the difficulties depends on the strategies developed. So how they develop their strategies to cope with it. So we talked about learning difficulties in academia. So we see affects each individual in different ways. Language processing disability makes reading, writing slow and challenging. Memory issues make students listen to text and repeat spoken words many times. More time for processing information before answering, affecting in participation of classroom discussions. ADHD disorder make it difficult to focus and pay attention, which is critical to learning. Organization, planning, and planning difficulty affect keeping track of assignments and handing them in on time an issue. So what was having an issue and impact in education then goes into employment too, because they need to keep up with everything that's required of them. Social and employment difficulties. Person with specific learning difficulty and attention deficit has difficulty maintaining relationships and employment, because obviously the tasks, not being able to multitask, being able to finish things on time, not only starting but finishing the job they're given is also an issue sometimes with some people. Finding organization, impulse control, and reading social cues a challenge. So they are not only facing challenges in school, but once they finish school and go into employment, from a social and educational point of view, they struggle because of certain things that they can't do, which makes it difficult for them to stay in employment and obviously lead to bullying as well. So now we get, next slide, Tiffany. So now we get to the crunch of the whole thing. What are the types of learning disabilities? So we've got dyslexia, and we know it's problems with reading, writing, spelling, speaking. Dyscalculia, problems doing maths, problems understanding time, using money. Dysgraphia, problems with handwriting, spelling, organizing ideas. Dyspraxia, which is a sensory integration disorder, problems with hand-eye coordination, balance, manual dexterity. aphasia, problems understanding spoken language, poor reading comprehension, auditory processing, problems with reading, writing, comprehension, language, and visual processing disorder, problems with reading, maps, charts, symbols, pictures. So it's recognizing what they're seeing. So the learning disabilities now are broken down into what types they are. So there are 7 different types of learning disabilities that are recognized. Can we have the next slide, please, Sam? Okay. So we talked about dyslexia first as a type of learning disorder. It's a language and reading disability. It's a language-based disorder in which we find that the individual has problems with linear sequencing, like alphabet, timetables, sentences, letter sound and association. Short-term memory is a problem. Struggles to retain information without reinforcement. I'll go back to the first slide. Thank you. Poor oral reading skills, poor reading comprehension, inconsistent listening comprehension, literal interpretation of language, auditory perceptual differences, difficulty remembering directions, and poor spelling skills. So when we look into the diagram, okay, of dyslexia, part of learning, types of learning disabilities actually fall into here. You got auditory, vision, okay? We have the reading and writing, and memory. So in dyslexia, you've got 1, 2, 3 of the 7 learning disabilities here already within dyslexia itself. So that is a key area in learning dyslexia. Come on, next slide, please. Perfect. Now, dyslexia is one of the first learning disorders that people recognize in schools. So here the slide shows its prevalence in school. As an average, 13 to 14% of school population is affected. And we've seen the factors that affected the visual processing, auditory, neurological, memory, writing, reading. These are commonly seen in a school environment. So this is why, having seen the child struggling with something like this, the first thing that comes to mind is dyslexia. So to help the child with dyslexia, it will depend on the severity of it. So the accommodations and the strategies that are employed will vary according to the severity of the difficulty. Can we have the next slide, please? Next slide, Susanna. Thank you. The next one is dysgraphia, disorder of writing and expression. So the writing is not brilliant, it's very scruffy. So the person with dysgraphia has difficulty forming letters or numbers by hand. Is very slow at writing compared to its peers. The writing is illegible. You got mixed upper and lower cases of the letters. Difficulty writing and thinking at the same time, so they can't think and write at the same time. Slow writing speed, even when copying. You have reversal of letters, addition and omission of letters. So sometimes when they're reading, they'll add an extra word in there that's not in the sentence. When they're writing, there's irregular spacing between the letters and the numbers. The sizing is different, the placing on the line. So even if they've got a line that they need to write on, the letters are not quite on the line, or the numbers are not on the line. They might be in the air, okay? And they have fine motor skill difficulties. So this is dysgraphia, a disorder of writing and expression. Next slide, please. So like dyslexia, we look at the prevalence of dysgraphia in schools. And a study was found that 1 in 5 students is dysgraphic, which is a reasonably high number. Factors affecting dysgraphia are fine motor sensory issues, language problems, attention issues, and time awareness. So again, it's relating to another disorder crossing over with it and affecting it in a different way. So how can you help this child? Reduce quantity of work, reduce it down, break it into pieces, give a small amount at a time. Use computer or laptop because they have difficulty writing. So what do you call it? An intervention of assistive technology can be used here. So if they get tired writing and are not doing that, give them a laptop, maybe that might be easy. Now, I do recognize that in a lot of different countries, getting a laptop in school may not be easy. Okay, we're based in the UK where there are facilities like this. I'm sure I'm likely to get that sort of remark made that, you know, unfortunately in countries like, for example, Pakistan, it's not easy. I do recognize that, but it's a very useful thing to have. Or teachers can allow extra time for the child to write and finish off their work, or use graphic organizers. So you can break it down into little chunks. Okay, if you haven't got technology and you're unfortunate not to have it, not a problem. Give them enough time, and it should work. Can we have the next slide, please? Then we have dyscalculia. It's something we have not, a lot of people haven't either heard of, or we don't recognize. We know writing is bad, but we haven't looked at the math concept in the whole picture. This is problems with concepts and word problems. So in education, we know that it's difficulty understanding math concept, but inability of understanding meaning of numbers and their quantity, difficulty remembering facts and formulas, may have difficulty remembering basic math. Okay? And we talk about basic maths. This is why we find that either children or some adults also have problem when they're giving out money. How much money do I need to give to buy a chocolate bar? And then I've given a note, okay, of say £10, and the chocolate is £1. How much money do I get back? So if they don't have a basic maths concept, they won't remember or recognize how much money they should get back from the storekeeper. So that's difficulty with basic maths. That's an area. So we don't look at maths and we can't do the sums and then that's it. It's only to education. But basic maths goes into normal life as well, where using money, using change, using time, remembering time, and time concepts, they need to be used, but that's from a maths point of view. But dyscalculia is where they have difficulty with this sort of a thing. There you go, I just said it. Having trouble handling money. Difficulty with spatial awareness, how far away they are away from a table before they put the cup down on the table. So it's a spatial awareness, where they are, where they're standing, how far away are they off the ledge at the door. They might trip over. So recognizing all this is a spatial awareness thing as well. Behavior-wise, they may have trouble paying attention, may have aggressive behavior, may suffer from anxiety, delinquent behavior to draw attention. So if they're not remembering, so it goes back to the education side of it, not remembering, not being able to tell time, not able to track of time, handling money, understanding the meaning of this, or when you look at the behavior, again, there's a root cause of it somewhere else. And it's that root cause that, again, emphasis is time and again, we need to look at the root cause of the problem, not the physical problem we're seeing initially. Next slide, please. So just like the others, we look at the prevalence of dyscalculia. And statistics show it's between 3 to 10%. Now it's not just like previously, what I didn't put down is that it's not all doom and gloom. They all the disorders have their positives too, not just the negatives. But in order to understand them, we always look at the negative points. So they are not all just negative. Like for example, dyscalculia, they have their strengths too. Some people are dyscalculic, have good math problem solving skills, strong spatial ability, pattern recognition. So there are positives too. But as disorders go, the crossover, the comorbidity also plays a part. Now, dyscalculia is affected by dyslexia. It's affected by visual spatial difficulties, language disabilities, working memory limitations. So aspects of dyslexia that we had earlier on, which showed memory, auditory, some aspects of that are actually affecting dyscalculia. So the crossover comorbidity again shows itself here. That dyslexia side of it is affecting how dyscalculia goes. For dyscalculia, if they're having math concept or addition, whatever, we can use calculators as an accommodation, or they can work on graph paper. So they can easily have the maths written down and they can follow it reasonably well and not lose their trend of thought. Next slide, please, son. Okay. So now we're on to dyspraxia. And dyspraxia is a sensory-based disorder. And it gives rise to problems with motor coordination, be it fine motor, gross motor skills. Now, one of the things we see in the classroom often enough is a child with an abnormal posture, lying down like that, or having an issue with a medical issue, hence the posture is abnormal. They have a balance and movement issues, poor hand-eye coordination, always complaining of fatigue. They're tired, the hands are tired. Can't write too much. We look at it as an excuse, but it's not. Sometimes it could be that the fine motor, which is what we need, doesn't, because they have a coordination issue, it starts to hurt them. They have trouble learning new skills. Organization and planning is a problem for them. Difficulty writing or using a keyboard. Having a hard time with grooming and household chores. For example, can't comb their hair. It's difficult. Can't do the buttons in a shirt or a blouse or tie their shoelaces. Is a fussy eater, is a trait often seen. Organizational skills are a problem. Some of us may have seen that children have toilet training and bowel control delayed. So toilet training is a problem. Bowel control is a problem. And that's relating to a sensory-based disorder. They're affected by loud noise and bright light. They might be irritated by clothing tags. So they've got like sensory issues because it's a sensory-based disorder. Hypersensitivity, low sensitivity. If you remember, we talked about that in slide 1. So this shows up in dyspraxia. So if you see in this, thinking, okay, it's a sensory-based disorder, hypersensitivity. So again, crossovers are coming in. Next slide, please. Let's look at the prevalence of it. I've only got the UK figures here at the moment, and these are slightly older. I'm sure up-to-date figures will be slightly different. But this particular one, it shows that at least one child in every classroom may have dyspraxia. Male to female ratio is 2 to 1. And it talks about the various combinations. That is, the mother's side has dyspraxia, then there's a 37% chance of it being passed down. So depending which side it is, remember I said it runs in families. So it can be passed on from one person to the other. Not every child will have it just because the parent had it. That's not true. So you can get, in one it'll be more, in one it could be less. The second child may not have it. Okay, so it's all luck of the draw basically. The factors affecting dyspraxia are gross motor, fine motor skill, communication, concentration, which creates classroom difficulty because they have organization problems as well. But importantly, the prevalence of all the disorders I've mentioned will vary from country to country. But here, the figures, if I've thrown facts, is just an average look at. It's not related to a specific country, because the figures could be higher in, say, Timbuktu and not here in England. But this is an average. Next slide, please, Sam. Next slide, please, Anna. Next slide, please, Anna.
I have changed it.
Can we have next slide, please?
Yes, yes. Can't you see?
No, you're still on the dyspraxia.
I don't know why, but I've changed it. Maybe it is slow a bit or what?
You need to go to the aphasia one, which is slide 34.
Now you can see?
No, you're going down. You need to go up.
Yes, I did.
No, next one.
Just turning slow to you. Dyspraxia starts. It is open.
You got dyspraxia, then you need to go to aphasia, which is the next one down.
Yes, dyspraxia starts.
Yeah, now you need to go to aphasia.
It is there.
No, you're still on dyspraxia there. That's it. Perfect. Now we talked about aphasia as one of the learning disorders. Okay, and it's a sensory disorder which causes impairment of language, speech production, and comprehension. So this is a disorder that affects speech, but a lot of times it affects a person's ability to communicate well, understand, produce, or read written or spoken words. So this is something that affects it quite well. That speaking, communication is affected. Again, just like all the other disorders, it presents itself differently in different people. So each person is affected differently. Again, just like the other disorders that we said earlier on, it doesn't affect intellect. So the key to remember here is this, that it doesn't affect intellect. Now, this could arise from a result of a trauma. So it isn't always happening. There's got to be some sort of a trauma that happens where speech is kicked out the equation. It could be a stroke, or in rare cases, a neurodegenerative disorder. So speech could go with a neurodegenerative disorder. So aphasia is also a sensory disorder, as we've seen, and it affects each one differently. We'll go on to the next. Next slide, please. Okay, so just like all the other disorders, we're going to look at the prevalence of aphasia. And we see that 85% are caused as a result of a stroke of some sort. Now that can come at any age. It could come in childhood, okay, from birth to old age. It can come at any time in that area. If it does, that's what happens. That speech is affected, communication is affected. 1 in 3 people experience aphasia after a stroke. And the factors that affect aphasia, you've got stroke, brain tumors, head injuries, infections, or not injections, sorry guys, other neurological conditions that damage the brain. So speech aphasia or speech difficulty can be with neurological conditions that damage the brain. Certain parts of the brain are knocked out, hence speech is affected. So aphasia is with some sort of a trauma. Move on to the next slide, please. So we've got auditory processing, not being able to understand or listen carefully of what has been spoken, the understanding of, which does happen too. So again, we've got the prevalence of that. 2 to 7% of the children have an auditory processing disorder in the classroom. Again, as we have seen, it's always, the male ratio is always higher to the female ratio. Factors affecting auditory processing: dyslexia, other learning disorders, frequency of sound, speed of sound. So now we're seeing that here, some of you are highlighted by a specific disorder that is like running all the others or having an impact on all the others. And dyslexia is showing up a lot more. So how can you help these people with auditory processing? Sit closer to the teacher in the classroom so you can hear what she's saying, because the sound is distorted, distracted. Work with the language pathologist. Auditory processing skills improved via targeted processing exercises. So the speech therapist will be a useful area to approach, because they need to target specific exercises, need to target specific strategies that they need when working with their client or child or patient. Next slide, please. Now, visual processing, in my opinion, is one of the key factors. It is sensory-based. It hinders the ability to make sense of information taken in through the eyes. Sana, can you have the visual processing slide, which is the next one? Sana? Sana, can we have the next slide, please? Hello? Hello, Sana, can you hear me? Thank you. We're going to get the slides on now, so everybody can follow now what I was saying earlier on. And I said, in my opinion, visual processing is one of the key players, because it's a sensory-based disorder. It hinders the ability to make sense of information taken in through the eyes. So a lot of the information we take in is through the eyes, okay? The other one being the auditory. So if something is affecting these, then again, the decoding and receiving of information is affected. Okay, so how do you see a visual processing issue? Sometimes we see the child tilting ahead when they're writing, or covering their head like this to cut out the visual impact. Easily distracted with poor concentration. Loses place and leaves out words. So with the visual processing, we see that in reading, that it loses place. So it starts at line 1 and then suddenly boom, he's at line 3. And then has to go back to read what it was, because the teacher says, you're not there, it's this, and he starts again. He or she starts again. And then they start to add words or miss out words when they're reading. So visual processing, there's a few types that in education we start to see what's happening. Visual defensiveness, so it's sensitive to light and sound. Okay, so low, high. Generally, it's the higher end of. Under-responsive, visual under-responsive. That means that he's seeing it, but he's not responding to it as quickly enough. For example, he's walking in a park near a swing and the swing is swinging. He's seen it, but he hasn't worked it out to get out the way before the swing hits him. So visual under-response, the visual system is not processing as quickly. Poor visual discrimination, cannot differentiate between similar looking letters like a B and a D. BDP, having difficulty with. 2, 5, and S, can't recognize it as a 2, it's a 5, says the wrong thing. Struggles with depth perception and non-verbal body language. Poor visual motor skills, so hand-eye coordination. Now, we talked about dyspraxia having hand-eye coordination issues. Now we're seeing that visual processing has hand-eye coordination issues. So again, here there's a crossover of disorders. Poor fine motor skills like coloring. Visual dyspraxia. Now, visual dyspraxia is planning what to do. For example, we're filling up a cup under a tap and we know it's coming up to the top. And then at the last minute, we'll remove the cup and close the tap. For these people, the tap will be there and it'll start to overrun. So then we worked out that if it's coming to the top, we need to remove the cup and close the tap. Just the overflowing of the cup. So that's visual dyspraxia. And then the final one, as part of the visual processing, is visual memory. Ability to recall details, copying words or sentences as they have memorized one letter at a time. Visual sequencing, this is how we do visual sequencing. They see the number and they put their thread beads or whatever. Remembering visual details in correct sequence. The kids struggle with spelling and reading. So this is due to the visual processing that takes place. And that to me is one of the key elements that affects other sensory-based issues as well. Can we have the next slide, please? So how does visual processing affect all of it? Again, studies have shown that 1 in 10 children have visual processing problems. The factors are focusing issues, coordinating issues, visual tracking issues. So this is like on a page. They start reading a line and then they move away. Visual stress due to the glare from the surrounding and the surfaces. So the glare that's coming off, although we say, well it's written on white, black and white, black writing on white paper. But there's a glare coming off that paper that is affecting the visual processing. Now, the visual processing inside of it is a processing issue. The person may have normal vision or 20/20 vision, as some people understand it to be. So the child or the person can have 20/20 vision, yet can still have this, because this is a visual processing, which is neurological, sensory based. How can we help these people? Just like everything else, there are accommodations for it. There's vision therapy that can be used. Color overlays for reading. So if they're reading on white paper, you can get a color plastic cover sheet, putting over the top. So you're reducing the glare effect. When the glare is taken out, the reading is a bit better. The child can maintain the place because visual stress is being reduced. You can change the background color of the paper. So when white writing is not very good, you could try color paper and see if that makes a difference. So these are accommodations that can help persons who are having difficulty with visual processing, which again, in education, if they can't process it, they can't focus, they can't coordinate, they've got an issue. Next slide, please, Sana. Now, ADHD is a very big topic, but it is relevant to learning difficulties. So I'm just going to touch on it very simply. that in ADHD, we see that he daydreams frequently, lack of impulse control, always instead of putting his hand out, blurting out the answers, which is commonly seen. Okay. Struggles to complete tasks. He starts in earnest, we start a big project, and then he's just started, and by then everybody else has finished, and he hasn't got round to it. Is impatient, can't wait his turn. Always, if it's in a queue, always needs to be at the front of the queue, needs to be served first, things like that. Acts without thinking of the consequences. Plays roughly. Gets frustrated to the point of meltdown or tantrums. Struggles socially. Fidgets and moves constantly. Has trouble with non-verbal cues. So now we're starting to form a picture in our mind that, okay, so it says rough, okay, so it could be ADHD. Okay. And this is the key, is recognizing the traits in order to have an idea of the symptom, in order to get the accommodation and the strategies to work with that person. Next slide, please, Sam. Okay. Now, ADHD, the prevalence of. Now here, there's two schools of thought, depending on the criteria used to measure. Different countries, again, have different methods of measuring. This is a slightly older slide, okay? So if it's measured according to DSM-4 criteria, then it's found that 6 to 7% of the school population is affected by ADHD. If it's measured by the ICD-10 criteria, then it's only 1 in 2%, 1 to 2% children affected. The funny thing is here is that rates of ADHD are very similar in most countries. That's the unusual bit, depending on how it was diagnosed. In ADHD, the ratios have changed. Normally, up to now, we were seeing roughly 2 to 1, 2 boys, 1 girl. But in ADHD, the ratios change significantly, and we have 3 to 1. The boys have a higher role. But here, a lot of thought is changing a little bit. Is to say, in males, we see these traits and the symptoms of ADHD a lot easier. In females, it's different because they show the traits in a different way, which sometimes goes unrecognized. So is it really 3 to 1, or is it a bit better than that? Nobody knows at the moment, anyway. So the ratio at the moment, we can say it's 3 to 1, but I believe it's a bit more than that, but it's just that females show it differently, hence it has gone undetected. This is a crucial fact. 30 to 50% of childhood ADHD diagnosis continues into adulthood. So this is something that needs some sort of intervention or work on, because from childhood, it will continue 30 to 50% into adulthood. And again, because it's continued into adulthood, 2 to 5% of adults have the condition of ADHD. So this is one of those that even I have parents saying to me, the child's got ADHD, but you know what? I think I've got it too. So it's down to our other point we said earlier on, it runs in families. So possibilities dad might have it, dad might have it, mom might have it, and it's going to come in the child. But adults have a different way of showing it, hence it's undetected, or they have a better coping strategy because of their age. Next slide, please. Now, this is an old research. This was done in 2007, so it is slightly outdated, but it still highlights key areas. And that is this. It was done by IDEA, Institute of Dynamic Educational Advancement, on special education And it shows that learning disability in special education is the larger chunk. Now, this figure could vary. So modern figures could vary quite a lot, but this gives us an idea that the prevalence of learning difficulties in education is a large chunk. And obviously it needs to be worked at, because we are looking at, if we're looking at integration in schools, then this is an area that needs to be worked on. Next slide, please, Sam. Now, this is something is very close to me, because having spoken to a lot of students so far, and a lot of them are saying the same thing in a lot of different ways. And even as educators, professionals, we know that persons with specific learning difficulties are very capable, but something is stopping them. So it's not going from there onto paper. And what thing that these students have in their own way and in different ways said to me is this, that they need their parents and professionals to work together for the students' educational needs, so that the parents and the teachers have got to come together in some sort of a way. So they work together for the betterment of the child. A message to the parents is that stop comparing the child's progress to the progress of other students in the class. This is a point that really hits me home, that parents are always comparing their child to somebody else's child. Your child is different, so don't compare. Again, aimed at parents, stop pressurizing them to achieve as they are struggling already. Now, this is something I saw on my travels, that children in mainstream schools, there is a high expectancy and pressurizing from the parents. But in special education schools as well, it was being highlighted as well, they are under pressure to achieve. The message from the students was this, that let students work to their strengths and pace. Okay? Give them care and support and right accommodations, both at home and in the classroom. So if the teachers and the parents are working together, then how the teachers sort of like the strategies at school are passed on to strategies at home. So they've got to work together. And this was the clear message that students wanted to put out there to everybody, be it the teachers or the parents. And that is this, that they are not dumb, retarded, slow learners, lazy, or incapable. And that was the message that almost everybody I spoke to was highlighting in a different way. So students are not dumb, retarded, or stupid. They are quite clever, but something is stopping them. Next slide, please, Sam. And what was evident is this, they're actually crying out for the support. So support is vital for children with specific learning difficulties to achieve their dreams and fulfill their parents' expectancy. This can only be done with the right provision in place, like structured educational support, rigorous IEP plan, tailored Can we have the next slide, please?
Sorry, I think my computer was disconnected. Let me do it again.
Can I have the next slide, please, Sam?
Yeah.
That's been done. Can we have the next one?
Support?
Can we have the next slide? The last slide.
Okay, the last slide. Okay.
That's the one. So here I mentioned that some very, very famous people have walked this path too. Okay, and we can see from the picture, this is a picture of the famous dyslexics. Top of the list, as we know, is Mr. Einstein. And then we have Leonardo da Vinci and Thomas Edison. And these were people who had learning difficulties. Yet what they have achieved has changed a lot of things in the world. So there is hope for everybody with the right support, with the right accommodations, and a parent and a teacher who never gives up. Hopefully, these individuals will achieve their true potential and hopefully make a valuable contribution, be it to their homes, to the country, to everybody. So thank you very much for listening to me. And hopefully there are a lot of, there's a lot of good information from what this PPT and the webinar showed to take away and get an understanding on learning difficulties in the autism spectrum. So thank you all once again. Thank you, Sana.
Thank you so much, Mr. Zahir. And I have no words. And I can't just live for those words that I must say today. That you have done a marvelous job here. And it's just like amazing that we have understood each and every point of learning disability here. And as a parent, as I say, I can now teach other people very well, and I can give them hope that please do not get stressed and push your children that you should do this, you should do that, and you should understand.
So a lot of people are, a few people are not getting your sound. And I can hear you, but
okay.
Other people I can't hear you.
Okay. Yeah, hello.
Readjust your mic.
The mic is the camera.
It's much better, Sana, compared to before.
I think I should come near its mouth.
It's better now.
Okay. Okay. So if anyone has questions here, so one by one you can ask, and I will start.
It would be better if you just name a person. If she or he has a question, then if they don't have a question, we move to the next one. That way it will be a systematic affair.
Yeah, so I have on the top line, I have Anila Zahir. Anila Zahir, if you have any kind of question, you can mute your mic. Yes, Anila.
No, I don't have a question.
Hi, that's Anila. Yeah, your mic is muted, unmuted now. Okay, Mr. Nathan, if you have any question from Mr. Zahir.
Hello, can I
yes,
ask?
Please.
This is to thank you, Sana, for this. It's a very wonderful session. I have learned a lot of things. I thought it was just dyslexia and autism, but there have been a lot of things here. How do I can get Dr. Zahir to come to Malaysia or do the presentation to our government or to our country? Will you be able to do that? To Dr. Zahir?
I would be. It would be a pleasure to come down to Malaysia. Not a problem.
Maybe virtual, but not at this time because you are having a very bad time with this COVID. Maybe
Yes.
virtual with session, yeah. Okay. And there is one issue I come across. You said senior, adult can get all this learning disability. ADHD. Is it because of age or is it because our blood system is all clogged up and all that sort of thing, or is it genetic?
What has happened here? Okay, what has happened here is that learning difficulties is more. We are more aware of it now. Okay.
Yeah.
The adults that have it have what we call slip the net. Because say in my time, for example, okay, learning difficulty wasn't heard of. You were, excuse the word, a dumb child or a naughty child, okay,
yeah,
in the classroom. And now it's a bit more recognized, and schools or teachers are a bit more aware that there might be issues with the child. Whereas before there wasn't this education. Although this education is not out there completely, at least some knowledge is out there to sort of say maybe there is an issue, whereas in my time there wasn't. So hence the adults you're talking about are more than likely they've missed the net. They've not been diagnosed, whereas now their child is. And as I said earlier on, that I get parents who say, "Oh, I think I have this as well," because the traits have been shown up in the child. So it is quite common, but I think a lot of the adults who've got it, because it runs in families, it goes into adulthood, it's because it's gone undetected.
When do we start this education accreditation? Because I don't think most of our education, our teachers are aware of the detail, but you have gone very detailed about it, you know. And when do we start? Is preschool or during school time? Because here at the same time, there are parents who want them to be in the premium, in the mainstream. But there are some who wants the parents to have the children in the special class. So
Right,
what
yeah.
is your advice?
A lot of the sort of interventions come in at when the development milestone of 7.5, 8 years of age. If the call it the symptoms and traits are there still and remain, then they're going to remain longer. Between say 0 and 7.5, for example, the development milestone changes, the triggers affecting the child change as well. Okay, but I say 7.5, 8. If say, for example, if the child is showing dyslexia traits, for example, then they're not going to change, they'll continue. So 7.5, 8 is the ideal time because all development milestones should have been met by now, unless there's a delay.
And should they be in the common class or should they be the special class?
That is a slightly difficult one because a lot of the times special schools are available, but they might be private and not governmental. Hence, the parents might not be able to afford it. Ideally, if the child is capable enough, then they need the right accommodations to be in mainstream. Because with the right accommodations, one-to-one help and what have you, if they can integrate that in mainstream, then the child can be in mainstream because all have a capability, just untapping it.
But the level differs because I've seen some students being in the mainstream, but there are some they are in the special class with a small group of students, maybe 8 to a teacher, this sort of thing. But
well, because that's reducing the numbers because a lot of the times the classes are very big, okay, and you might have one teacher to 30. So obviously, this is where what we were talking about earlier on in the PPT, that like a one-to-one support. okay, for the child. So it sometimes is not easy in a mainstream school. Then they need to be in a special school. But having said that, it's I feel that that's a bit detrimental to sometimes to the kids as well, that the kids in the special school might not be at the same IQ that they are at, IQ level, didn't he? So the child is not necessarily going to make a lot of progress in that environment because everybody else is lower than he is. So there's nobody pushing him. Okay, so he would, with the right accommodation, be better off in a mainstream school where he will be able to push to a better level. Whereas putting him in the special school might initially be beneficial to him, but then it could be that he's not progressing that much. In fact, he's regressing because there isn't nobody to take him to a different level. So maybe looking at IQ levels and having special schools with same IQ level students in the class, not age, because there was in most schools they put age. Okay, so if you're 15 years old, you'll be in class A. So you could have a 15, say a 15-year-old in class A who has got an IQ of I don't know, 70, 80, and you might have one that's lower 70, and the two are struggling, and the lower 70 is struggling to keep up with those. So he's not going to benefit, he's going to give up. So ideally, if they can find a new route where people of the same IQ are in the same class, then we can maintain the progress because then they're all developing together.
Definitely, it's just like my daughter. She had a high IQ level. When she was in class 8. The teachers told me that your daughter isn't. She doesn't want to give the papers. She doesn't want to appear in the exams. She doesn't want to sit in the class. I said, why? They said because she knows more than the 8th grade, and we don't know how to keep up with education level that she needed. So in Pakistan, like we have, if the age appropriate age should be there when the child is in the class, like it's in 3 class or it's in 8th grade, or she's in the 9th grade, it must be appropriate to the age group. So she didn't want to learn or study there. In the final exams, I asked her, why did you do that? Why didn't you give your paper? And she said, Mom, these are the children's questions. My brain was more high. So please don't ask these stupid questions. This is the word she told me. I know everything. So I need something more. I need something huge. I want to learn world history. I don't want only to learn the Pakistan history. I know these things. I know all of the others. For example, I must tell you. So she was the first one to raise her hand. Teacher told me she knows everything. And we know that this child is very good in her academics, but she doesn't want to sit in this class. She thinks, I know everything, I should go forward. Then I asked the school, and the principal said, no, we don't have that, curriculum for her in class 8. We can't shift her to class 10, jumping into the classes. And then these were the issues that my daughter became from school. She couldn't go to it. So the schools are really important, and the teachers are really important to be trained, to have new setups, systems in schools according to the child. This is really important. So my daughter lost her years of those education years. It was very important.
I learned a lot of new things tonight. Thank you very much.
You're very welcome. You're welcome.
Yeah, thank you so much. So, we have other people here who want to raise their hand for the question. Please raise your hand, or you can ask. You can unmute your mic.
Sana, can you hear me?
Yes, please. A little.
Okay, great. I want to just thank you, Dr. Ibrahim, for the great contribution that he gave to our understanding today, to enlighten. That's how he started uh, the first few sentences this morning about what he wanted to just help us in just expanding our understanding about autism and learning disabilities in general. My one is not really a question, but I just want to thank him because I think the message that need to come and just go around like a tam-tam around in the world in the educational field is something, is a common message that just put all of us together. So please don't pressure your students, just respect their peace and their, different children, as is brilliantly said before, have to learn at a different pace. They have different strengths, different abilities. And it's us that we need to just slow down, step back, become good observer, and just change the way we teach. We just need to go visual, just more when, or just accommodate the, synesthetic needs that a child might have. If he needs to move, just put a ball underneath his, instead of the chair, just use a special ball so they can move around. So there are so many different strategies that we as educators need to know in order to accommodate their needs. So it's up to us to be more prepared to the future educational challenge. And I think what he said today is really a message that should reach everybody in education, because we need to stop comparing students and stop thinking about their progress, pressuring them, and just teaching children to compare one another, being competitive. No, this is leading the world just to having mental issues, and is just future and present generation. And for us to work also in a medical field, we understand how this can really affect the mental state of our children. That is our present and our future. So please listen to what he is saying, and I really hope, and that's what Maria Pia will, wants to do as well, trying to organize for Mr. Ibrahim to just also be able to teach other educators and teachers in school, because these issues are experienced in any countries. Knowledge are learned in university, in educational fields, but then there is something going on, and this knowledge that just don't get applied in real life. So we need to make sure, like you did, Sana, organizing this, that we as adults take responsibility for this, and just we make sure that expert people like Dr. Hebron can just pass their message to parents and teachers and educators and pedagogists and educational professional, doctors, GP, that do their practice every day, and they don't recognize what learning disabilities or autism is before a child is 5, 6, 7, sometimes. Hopefully we won't see these things anymore. Early education and early intervention must be in place. We need to be able to recognize early signals. traits. We need to know the basic skills that Dr. Ibrahim, in very detailed, just transfer to us today. He went into very detailed, so it's not just the basic, but at least if we know half of what he was passing on to us, we will be more prepared. We will be understanding who is in front of us, and then we will be more quick and we will intervene quickly. That's what we need. And it's just at the tip of our finger. I can't accept this anymore. And that's why we are speaking out. And even in Italy, we have opened this, just web trying to, I'm just cooperating, but we are trying to make sure that the message pass and gets across everywhere to many people as possible, because it's not possible that we fail the people that need the most. And we know this is an issue, not just in the country that you mentioned previously, in any countries. Okay, so that's my hope. And so thank you very much, Dr. Ibrahim, for taking the time to just explain more in details what we need to be more careful to see in others, in our students, patients, whoever is in their practice as a GP or as a pediatrician or in any field. We are not going to stop with this message from just saying this because so all of you that are listening to this, all the other people that will listen, the people that will passing on this message. So there is lots of hope in the future, and we are not going to stop this. This has to be pandemic. This has to be viral. Taking care of our children. This is the most important things in the world. This is how we will survive as a species. We need to take care of these issues. It's not a problem of my neighbor, a problem of somebody else. This is about all of us. So thank you very much.
Thank you, Eleanor. Thank you so much
Eleanor.
for supporting.
Hi, can I ask a question?
Yes, please. Please, Rian.
Hi. Hi, my name is Faria. I'm originally from Pakistan and I'm a pediatrician by profession. But now I'm talking with reference to my own child. So I'm based in UK now in London, and I'm extremely frustrated from how my child is being handled. So to cut the long story short, we had quite early diagnosis of autism, and despite exploring everywhere, my child just started reception, and school basically has no understanding how to make him learn. He's an exceptionally intelligent child, but I think they're just messing up with him. So I am just wanting to know, is there anything available online for people who are not physically in Pakistan where you guys can help? Dr. Ibrahim, Professor Ibrahim, you had a brilliant talk. And I have been, going to different webinars since the time my child had a diagnosis, but still reaching at this stage, I'm just feeling so ashamed of myself that I'm not actually able to provide my child what he actually needs. And I can't rely on the school who have turned their back, and COVID has been made a big excuse. Okay, we are not going to get out of this pandemic for a foreseeable future. So I need actually to find out if there are any resource available, anything which actually I can, educate myself more and maybe knock the doors of the school again to let them know this is the way to make him learn. Because I'm not happy for my child to go to a special needs school because he's not going to fit anywhere in that environment. And he's like a sponge now. He absorbs so much from his surroundings. and his peers in the mainstream are his main, he's learning from them. He's learning a lot from them, but just because school can't, they don't understand how to learn, make him learn the maths and this and that, and how to kind of include him in the class. So they will just, keep sending him home, that he was a bit naughty today, he was like this and all. He's under occupational therapy, he's under speech and language, and I'm literally frustrated. I think nobody may really understand how to kind of, help his learning.
Okay. Now you got two options there. Either look at a good modern special school. I think there's one, I believe it's near between Cambridge and London. It means going out. Where are you based in the UK?
So I'm in London. Yeah, we live in North London.
Okay. So you find a specific school. That's number one. Number two, the other option you have is maybe look at homeschooling if you are not happy, because the government schools or private schools don't, unless you got a very good private school, the government schools, especially in and around London, are not geared up for anything like this. As you've said, you've got a lot of like comeback with non-helpfulness. So you will still find that unless you go to a private school that is very good and is all for inclusive education. That's an alternative, or you homeschool, because you're not going to get it in the government school. That is a problem. On the net, there is not a lot of information. Now, this information that was done in the PPT here is what I have put together, and it's my understanding of special education or at a specific learning difficulty, which I believe that's what I put together. But there isn't something as well put together like this on the internet. There's a lot of research and what have you, but they are, in my opinion, I think they're looking at it differently, but it's not answering the parents' questions a lot of the times. So we will struggle. So there isn't anything out there on the net where you'll be able to read it and say, yep, this is what they're saying, so I'll be able to follow that. There isn't a structured following program. It's really a case of trolling the internet and finding somebody who has put stuff out there on the internet, okay, or educating it yourself, i.e. troll the internet and then learn from different snippets. So you won't have all the information you're looking for in one article, for example. You'll end up reading hundreds of articles, okay, to understand what they're saying, and then picking out, as I was saying earlier on, looking at the symptoms and traits in your own son and saying, okay, so he falls here, he's got some of this, he's got that. So you're observing your own child and then working out the symptoms and traits that he's displaying. But how old is your son?
He's 5.
Okay. So again, not all the development markers have been met, because I was saying earlier on to Dr. Khatija that 7.5 is when all the development markers are met. So hence, whatever he's got now may change because the triggers will change, okay? So at the moment, it's just a matter of managing your child for the moment, and then the accommodations can come in. The other thing I can say to you is this, that if you go on my Facebook page, there's a lot of strategies I put for parents that they can look at, okay? And the articles within those are pretty good as well. So that may be a useful source for you to pick up information on. But as such, as far as I'm aware, there may be, but it might be in different areas that are not connected with autism as such. Articles that would be helpful to you. So I think have a look at that. That's the only thing I can suggest on the top of my head, that have a look at the articles on my Facebook page. Some of them are pretty good. And within the articles are other articles that you may find useful, and see how it helps you. I'm sorry that's not answering your question the way you would feel happy that it's answered, but unfortunately, I'm not aware of the London area and schools there that I can say, you know what, go to here, go to B, go to C school, and they'll be able to do it. But in terms of information, there's nothing on the net. That's for sure.
Okay, thank you very much.
Victoria, I want to tell you something here. We are trying to work a lot in schools. We have trained some schools here in Pakistan, especially in Islamabad. Zamzam is also working for adults as well as for children. I must tell you that I am aware of all this situations around the globe. But the thing is, teachers are needed to be trained. And if we parents fight for our children, and we must get together, and we should talk about it in schools. Like only you, if you will go and talk about your child, you need to have a group of parents, and they should support you, support the other children as well. Okay, I've been to the government schools in Pakistan, and when I gave the training and awareness, actually, it was an awareness. It was not a training, but it was an awareness. So the teachers were so happy, and they said, we have lots and lots of children in school. So yeah, it's not only one child or two children in one class. So in Pakistan, there are like in one class, there are more than 60 children, 50 children in one classroom, okay? So just imagine how these teachers are coping with them. When they have lots of children with ADHD, dyslexia, and other learning disabilities, how are they coping up? They want to learn, actually. They say we can cope up, but we need trainings, we need education in this field. We don't have. So we, as a parents, we should come together and we should do some awareness in this to the schools. Why don't you do that? Are you doing it with that school, with other parents? Second, we had a school, like my cousin sister, she had a school in Islamabad. Basically, it was for underprivileged, but we had one autistic child in that school. And the mother was just like you, she was so frustrated. And she said, my child can study, but nobody's taking him. So we said, why shouldn't we give him the curriculum that he can study, the subjects which he can study. And then we gave him the teachers, like one-to-one and other, but we never like put him away from the class, or we never dropped him from the school. We worked with him. It was kind of a research for us. That child, he did metric. That boy, he did metric. Like he was there for 6 years in that school. That was a normal mainstream school, and he went there and he did his metric. After metric in college, the mother was again in trouble. So my point here is we need to get together, like today we are. We need to train the schools. We need to go to the schools together, not alone. I'm like, if I'll go alone, you're going alone and you're fighting for your child. We should go together. We should have a group. We should go and make awareness. We should meet the principals. We should meet the directors of the schools and the elders. So we can change it. If we didn't have it for our children, we didn't have it, we are sitting right here for your children, smaller ones, the babies, the coming babies, right? So never, never, ever lose hope. You're going through this, you know this is happening in the world. You can help others as well, okay? So please do not lose hope. You keep up trying, you look for the school. So I've been to Italy, I've been to Malaysia, and I've gone everywhere for my child. So we are here to help you, and you can always ask whatever you want, every time, anytime from me especially. Mr. Shabir Halfan.
Yes, thank you. First of all, hats off to Professor Ibrahim, and all of you for thinking of this and putting it online so people could benefit. It's really a positive initiative. And honestly, I've been following him all on his Facebook, and lots of learning happened today. So thank you ever so much. Just echoing what I hear the concern from my colleagues as well, and even from yourself, that yes, we need to create awareness. And I'm just thinking aloud that it's very hard for a teacher, or maybe there is less initiative by the teachers to go and Google and make up something like this and, then create awareness in the school. But with the abled people like Professor Ibrahim here on board with you people, and having the same vision, if you could create some kind of awareness clip on YouTube explaining like we did today, or for that matter, this webinar, I see it's being recorded, could be put on YouTube, and then we can just at least inform the teachers that there is something like this. You can take initiative and just go through it. I think it would be very helpful. Or if there is a way we can make something concise and post it on the YouTube so that people, teachers can access it and at least start understanding this, just even at the foundation level. I'm sure many lives could be saved and changed. So it's just a request.
So much we have a YouTube channel, and Mr. Ibrahim have also videos with him, and we will definitely put this online, and we will try to do it more and more webinars, inshallah. Thank you so much for being with us here, and for
Thank you.
sessions. Thank you so much. You can also,
I would like
you all
to
can
add
also
something.
contact each other directly.
Okay, I have heard the question being asked by various attendees of the training, and I've heard Dr. Ibrahim also. First of all, I would like to thank Dr. Zahir Ibrahim for a detailed training that he has imparted today. And secondly, with respect to Mr. Shabir, I have already mentioned in the chat that Dr. Zahir Ibrahim was the first drop of rain, and we'll be starting with more trainings in times to come pertaining different aspect regarding special needs. But one more point, like Faria Anjum asked, that was for the well-being of her child. For teachers and for schools, his son is just a number that we should understand. That is the core reality. But for parents, we are the one going through the pain. So we are the one who should gear up themselves. There is nobody, no expert on this earth who could know the well-being of your son and the problems faced with more than the parents. So knowing the problems well, it is up to us that we gear up ourselves, we equip ourselves, and we impart training to our kids. I'll agree with Dr. Zahir Ibrahim that homeschooling, that is the best option. You may keep sending your child to the school. That is good for social interaction and learning through social interaction. But keeping the other aspects, the homeschooling is the best idea. Thank you.
Can I just add a point onto that one? That you've hit the nail on the head, so that parents have got to take the initiative, because a lot of the times the parents themselves don't know or don't understand what their child has got. Now, they have been going, for example, to therapists, spending a lot of money, okay, and the results are slow in coming, and parents get frustrated. A lot of the times, a lot of parents will not complete a therapy program, okay, because they're not seeing results. In some cases, they are going to a therapist who's applying therapies that are not quite needed, okay, for the underlying disorders that the child may have. So if the parents recognized what the child has got, or near enough, made a good sort of like observation and say, okay, he's showing this symptoms and traits, and I believe he falls in this sort of a category. Let's just say dyslexia. Okay, so he's recognized that child has got dyslexia symptoms and traits. Then they look for, say, for example, an educator who kind of works a lot with dyslexia. Okay, then they send the child to that. So they're not, dare I use the word, wasting their money, but they're channeling the money a bit better. Same applies to the therapist. So it's like saying, I've sent him to the ear doctor, but I've got a problem with my foot. That's the gist of it, that he knows a little bit about the foot, but he's not a foot doctor. So sending it to the right type of therapist or the right type of person in terms of education, the money will be better spent and not wasted. So this is a key thing that you hit on the nail, sir, that parents have got to take the initiative, but parents have got to now start to recognize what the child has got in order to find the right therapist and the right educator for their child. And vice versa, it goes the other way, that the educator has got to recognize the child that they are dealing with, okay, and recognize the kind of method or methodology that they want to learn in, and apply that. So the teacher is an adaptable, not one shoe fits all strategy, but a multidisciplinary strategy that's adaptable. As I was saying earlier on, recognize, adapt, change to suit that individual. So basically tailor-made. So that is maybe the way forward, but parent recognition is probably the key.
Thank you so much. And we again have, I think, Mr. Zahir Ibrahim. You want another question? Yours? Your hand is raised.
Oh, sorry. No, it was just earlier that if we create a program specifically targeting the teachers, we can reach out to more people easily. Yeah.
Okay.
Thank you.
So we have Shazia here, and we have Esther Tangle. Esther, I just talked to you before the meeting, before the webinar. Are you here?
Yes, I am here.
Hi. Esther is from Malaysia.
Yes.
And,
nice meeting you, ma'am.
Thank you so much, Same here. And would you like to
and
ask
thank you,
any
Mr.
questions?
Zahir. Yeah, for the good webinar sharing.
Mr. Zahir. I think he didn't hear you. Mr. Zahir?
Yeah, thank you, Sir Zahir, for the good webinar sharing.
Thank you. You're welcome. I hope there was a lot of info there that would be very useful to, in fact, not just yourself, but all the parents, educators, professionals that have joined us, because it's the beginning.
Yes.
And I want to quote a phrase here that is very close to my heart, and that says, "Hope anticipates, faith believes, and patience lies in wait."
Yes, I have been following your Facebook for many years already. I've been seeing you have shared a lot of information about special needs. That's where I learned a lot also from your following your Facebook.
I'm glad.
Yes,
Thank
so
you,
why
sir.
don't you introduce yourself and your work, what you do here?
Yes, ma'am.
I said, why don't you talk about your work as well? What are you doing nowadays, and what do you do?
Oh, okay. I have a boy. He is 8 years old this year. He actually had a multiple diagnosis. The first diagnosis was mild autism, and then he progresses along the years. I noticed that he can read very well, and where I get to know with a group of parents that condition is called hyperlexia, and he belongs to the type 3 category that comes with autism traits. And then later on, only recently, I noticed he might possibly have ADHD as well. Yeah, so it actually grows differently throughout the years. Yeah, so now from what I have been following, Sir Zahir's Facebook has been reading a lot, and from there I do get to know some tactics how to handle him, as in like the behavioral management, that part. It helps a lot.
Okay. Amazing. Then we have other participants in the room. And anyone who have any question?
And can hear me?
Rabi? Yes, please. Yes, sir. If anyone wants to ask any question or to say, Mr. Rabi. Azim Muhammad, Mr. Azim Muhammad. Does anyone have a question or to say anything? Can you hear me?
Okay.
Okay. Okay then. Okay, thank you so much. Thank you everyone for being here with us. And inshallah, we will again come with another a webinar with Mr. Zahir, and I would ask him to join us again. And thank you so much, Mr. Zahir. Thank you so much. And you're supporting this Pakistan Autism Health Sciences and Research Foundation. And you are the first volunteer for this webinar, international webinar. Thank you so much. I'm so obliged.
Thank you.
Being a mother is really a big thing, you know, that people are helping us.
You're very welcome. I hope and pray that we can again meet up soon on a different webinar and continue this education for not only the betterment of ourselves, but importantly, for creating a better educational environment, as well as a social environment for our special children. Thank you all. Thank you for participating.
And now you're okay. Thank you, Dr. Khadija. Thanks for coming. And I know you're a very, very busy person there in Malaysia and working a lot. And I'm so excited. I'm so excited. We are meeting after how many years? Like I think 10. 10 sorry, your mic is mute.
Yes, I think over 10 years, about 10 years.
Yeah. 10 years. But you're always there for me. You're always there for me. You always teach me, do this and do that. And thank you so much. And thank you, Maripia, as well. Maripia, would you like to say something? Maripia is from Italy, Datuk, and she's also mother of Marco. And your mic is mute. I think you all can unmute your mic.
Hello.
Yes. Hi.
Oh, ciao, Sana. Yes, I am mother. My son is very old, but my goal is for autism, for help many people all the world. My friend, the doctor, help me also, Sana in Pakistan. I think this project start with Dr. Ibrahim, Professor Ibrahim. If you need main information, please give me one email. Okay, this is a global project, Sana, for Italy, for Pakistan, maybe for other country. But I think UNITEL is very, very nice for autism problem. Okay, but alone, no, is not very good. Working start together.
Together, like okay. And
alone for my child, for my son, sorry. Alone is not good. Now is important awareness for neurodiversity of people with autism. But you know, autism is no diseases, but is a this help me aspetta, condition. No, is no. Sorry for my English, but I speak Spanish, French. C'est-à-dire, sorry. Now I contacting with many adults with autism. This man asked me, Mom, why you want from autism people? Why you go see doctor for therapy? Why? I don't need therapy. I need help in a society for job. But I is normal people with like you, like other people. I don't need therapy. Okay, you understand? So my goal for our adult people is for independence life. Okay, my friend give me one apartment, big apartment, for start my project for independent life with 5 adults with autism. In this project, I have many industry help me. Maybe I have also specialist term. This specialist term is foreigner industry for technology, for mobile, okay? In this industry, many people with autism have a job.
They get trained and then they have jobs, yes.
Yes.
IT
so,
and all.
So now also in Italy have this industry specialist for help my child, my man, adult, no child.
And Dr. Khatija, this specialist turn is also in Singapore.
Ah, okay.
In Asia, it is in Singapore, so it's very near to you.
Oh, okay.
So
nice.
that is, you can bring it, you can ask them, you can collaborate with them, like I'm trying to collaborate with them now, and I'm trying to bring it in Pakistan. We want to start working on that for adults. So you can bring them here in Malaysia.
Sana, sorry. My team for Pakistan is start one model, okay? Why family need help, okay? If we start this model, okay, with the government, I think, give help for this project. But not only Sana with the therapist, with the professional, with the teacher. No alone.
No. Can't be done alone.
Together, ask ministry, I don't know, ministry, president in Pakistan for a new welfare. Okay? And this welfare is not expensive if together job. Is not very expensive. Otherwise, in Italy, child with special need is in a normal school, no special school. Special school need many money. Okay, what normal school with in the classroom with one child with special need in normal classroom with another teacher only for the child with special need. I think it's easy. Easy.
Yes, yes.
It's mentality. Need to try people need change mentality.
Definitely. We can do it.
I know it's a very difficulty in other countries, but in Europe, Italy is only Italy uses this methodology. And Germany and France have a special school. In Italy, no have a special school.
I've seen that. I've been with Dr. Marcello. He took me in Sicily, in Catania. He took me to the school and he showed me that like it is important that these children are in the school. And there were children studying in a normal school. And it's law there that they will study in a normal school. So in Pakistan, we don't have any kind of autism law. And you told me, you sent me the law, Italian law, I remember. And I have that law and I'm trying and like it should be, we should try in Pakistan together. Also in Malaysia, I think you have, Dr. Khatija, do you have a law of autism in Malaysia?
We don't have. But we have special school, but there are some parents, those are severe autism, they will put it in the special school, but there are some that they are in normal school, but now there are already, the society have started their own school for just for the autism. The private, I mean the parents by themselves. So there are government school, they're starting on, and we will catch up with you all because they have already now under the ministry. Before it was independent, now it's been taken over by the under Ministry of Education and the special project autism. So we'll get connected.
You can also bring that law and like you can introduce that law. They actually need a law. In hospitals, they have problems. In airlines, we have problems. The kids with these children, like they should know that they are not with. If I'm parking my car, they will say, "Oh, your son is walking. Why are you parking your car here? It's for the disability, the sign of disability." So we don't have that autism law in Pakistan. And Maria Priya, yes, please.
Sorry, you remember when I stayed in Pakistan 2 years? I see in Pakistan, in Lahore, in Islamabad, many schools for special need, many schools also for autism, many center, many, many.
So it means bring your children out of school to the centers. This is wrong.
Yes. It's very impressive. Very impressive. Many schools for autism, for children.
Yes.
Okay? But the family pay.
True.
Oh, I think is also for business.
True.
Okay.
Yes.
Is for business
because it's expensive as well.
Family pay for children is normal. Okay, but have many poor people, many poor family need also help. So rich people, poor people, no good. Now for this government help poor people.
Yes, we need government. Actually, in Pakistan, we also need government to come forward, just like Italian government is doing. You see?
Sana,
Maria Pia, actually the problem is, like I said earlier, that the parents should equip themselves, they should get educated, they should get
Yes.
awareness. The core problem is around the globe, if you see, the greater the problem you are facing, there are more people who are there to benefit from your problem. They'll loot you, they'll benefit from your problem.
Yes.
That is the core issue faced by the parents of special need children, because they are already faced with a big problem. They are already facing financial problems due to their child also, but accordingly then there are institutions who are running their business based upon your problem. So less your problem is handled by the government at mass level, at government level, these problems will keep coming up. Until that point, it is the parents who have to learn and who have to know which doctor to go to, which not to go to. And that you can decide only when you have knowledge yourself.
And we have Maria Ambreen.
Yeah, Assalamu alaikum. I would just want to introduce myself. I'm from Riyadh. Actually, the thing which you all are talking about is about us. I mean, I can just see that there are representatives from all around the world. That's really good. But parents over here, they even, especially us, the Pakistanis, they can't even, I mean, raise the issue. When I came here, I have just moved to Riyadh. Previously, I was working as a STEM teacher. Well, I'm a mother of not, I mean, his diagnosis is also, I mean, so uncertain. He was 3 when I enrolled him to the institute where I was working as a STEM teacher. I'm so sorry for the background disruption. He's just playing on his. So the thing over here is, first of all, there is not lack of awareness because of the social media and everything around us, but because of the acceptability. Parents are not accepting it, that yes, my I mean, point, yes. Yes, my child has some, I mean, what can we say, they are different able. My son was like, he was not non-verbal, he was non-vocal, and he was doing good in everything else, but he was just not speaking. So I just enrolled him into the school, and I was like, he would be fine like other, because I have 2 children, mashallah, 1 daughter and 1 son. He only 1 year, I mean, apart. So the things were totally different. He was, I mean, he was good, but he was not speaking. So over there, the school, it was run by an American curriculum and American-based school. So they were inclusive. I mean, they had the inclusive system. So, but the thing is that they were just having the tag of including. There were no facilities, no facilitator, nothing at all. Only just like for some time they were taking him out and doing like stuff. Overall, I mean, it was, he was having therapies at a center, just like the thing which Ma'am Maria Pia was saying about the business stuff. I want to highlight this over here. Here, the therapists, the centers, they are being aided by the government. The government has given the authority. I mean, it's not the Saudi government that are not giving us the space. Even the Indian community, they are running their own with a nominal fee and everything for their community. But of course, we cannot go into them. But for our people, I mean, it's very, I mean, very, I mean, what can embarrassing to inform you all that they are not taking any step. I mean, some parents, they just muster up the courage and they go and speak, but nothing happens. I mean, at the end of the day, it's vague. So most of the families, they have gone back or they have migrated to other places. I mean, those who are residing here, they are hopeless, and their children, they are around. My son, he would be 6 in February, and for him, I have done courses. I'm following Dr. Zahir's page, and it's really very informative. And I mean, I'm doing it on my own, but every parent is not the same. I mean, they are not hopeful. They are losing the hope. So this is very alarming, especially in Middle East, not in Middle East. Dubai has the same, system, just like you were telling about Italy, that they have inclusive educational system. It's going on over there. I have known some parents from Dubai also. But over here in Saudi, it's like it's a nightmare for us expats, especially for Pakistanis. So I personally know many families, they have gone back to Pakistan, and in Pakistan also the same business is going on. So I have just enrolled him into a home school that is UK based, and Alhamdulillah, he's doing fabulous, and they are, accommodating. That's their favor. They have accommodated him, and because over here education is like it's like two ends. One end is extremely, advanced, and one end is extremely low. And we are in the middle of the range, just like in the middle of the spectrum. Also, for his evaluation, I would like to ask, do we need to reevaluate our children? Now, as far as I know him as a mother, I think I have a strong, instinct that he has only, speech delay. He's only speech delay. Rest, he's fine. He has, he can even, he does whatever command is given, instruction following. He's good with the therapist, and everything is going fine. So do you recommend me that should I go for his reevaluation, or, once he said that he is mild autistic, he would be like this forever? How things go with such kids? I just want your insight, please.
Mr. Zahir.
Reevaluation would be a good idea, because then you know, for example, if you go to a center and they start your homeschooling, but for other parents who may be in a similar boat to yourself, they may go to a center, and then the center is applying also the different therapies and charging for it. Okay.
It's like too expensive here. I'm so sorry.
Yeah. No, I understand that, because I know in Dubai, there was a
Private is expensive everywhere.
But a parent was spending almost 30,000 pounds on her child a year. Okay, so yeah, Middle East is, this was UAE, and it is expensive. Over there it's expensive, and it's private as well. So getting it reevaluated, you would know, because the markers have changed. Okay, markers change. When the child develops, the triggers change. Okay, so what was affecting him as in the diagnosis, say a year ago or 2 years ago, might not be there this time. So you might, this is what I was talking about from an educational point of view. They need to be sort of like constantly monitored to see what traits are now being shown up. So what was before, okay,
yes,
with the coping strategy, that has like been able to sort of like control it, and then something else that was hidden behind it then comes up to the surface. So they are continuously sort of like overtaking one another as the person develops, because the triggers and the coping ability changes. But in terms of when you talk about major, like you're saying, speech is a major because it's communication, then I believe it's worth getting an evaluation as to where he is in the system so far. Okay. And if that's the case, a lot of the time you get parents who might be spending something like ABA, as an example. They might be spending money on ABA, but not paying too much attention to the speech side of things because they're seeing the behavior. Okay, but that's in a younger child, for example. So in the younger child, I always say to parents, look, speech is important, because if we don't develop that, then you're going to have issues long term. Behavior, until you are not able to control the behavior or handle it, more importantly, is a reasonable number of years. So pay what you call attention to the therapies that matter. So instead of giving him ABA, for example, to stop his behavior, which the parent can do themselves to a point,
exactly, definitely
concentrate and spend that money, extra money on speech.
And OT has helped him a lot. He has shown tremendous improvement in these two things. And for speech also, what I believe as a mom, and what I believe and what I see him, that he's not doing on his own. He's in his comfort zone. He knows how to do things. He's reachable to everywhere. He's good at writing, and now he has got into the school that are accommodating him. So just to, I mean, I will definitely continue with the speech therapy, but I mean, what else can be done with him apart from the therapies in the, I mean, in the educational sector? What else can I do? Because now he's homeschooling.
One thing you can look at, which as you saw in the dysgraphia side of things in the slide that was there, I talked about visual processing is the glare side of things. Okay. By changing, say, if he's right, he can read and write, for example, but if his writing is not too good, then maybe look at the option of changing the background of the color he writes on. Sometimes
yes,
that helps
I tried
as well.
it today. Sorry to interrupt you. I tried it today and he literally did it. I mean, he was not, I was just giving him blank white papers to do the activities. But today I changed it just out of blue. I had an idea, just change it to red. So he literally started to label the diagram. I just gave him the body of a human to label the diagram. And he did it in an excellent way. Previously, I was trying hard to let him do, but he was unable to do. So I think so this might be one of the reasons.
Yeah, so these are the accommodations for classrooms, that changing the background on what the kids write. I talked about color overlays, putting it over a book, for example, if the child is losing the space and the placing on the text of the passage. So say he starts in line 1 and then suddenly he's reading line 3. Okay, there's a visual stress that's causing that to happen. So using a color overlay placed on top of the text helps reduce that stress. Therefore, the child maintains his place and is able to read without making the mistakes like adding words or swallowing words, as I call it, eating the words up that don't exist on the page. That's worth a look as well.
Thank you so much. Thank you.
Mr. Zahir, Maria Pia, I want to ask you that did you ever been to Italy or can you come to Italy? And are you working alone or in the center? You're working right now in the center, you're freelancer.
I am able to come because I now I've gone to an area where I work freelance here, so I am able to go to Italy if invited.
And you're part of PAHSRF now.
Absolutely,
Absolutely. Part of PAHSRF. And you can also make him part of Project Isha.
let me put it another way. For the special kids, I will always make time.
You are welcome in Italy.
How sweet. Huh?
You are welcome in Italy. If you like.
Sorry, Maria, what was that?
Maria Pia, send her invitation letter, okay? Send an invitation letter, then it will work.
Maria Pia invited you to Italy. He says welcome.
No, verbal invitation is different. Maria Pia should send him an invitation letter.
And also,
maybe together after COVID.
After COVID, everything is after COVID.
Before COVID, Maria Pia, before COVID, you can organize a webinar just like this on Zoom.
They're doing that. They're doing that next month.
Okay, with respect to the discussion going on between Faria Anjum and Mr. Zahir, I would just like to add one thing. The basic knowledge, understanding of the basic knowledge about autism and understanding the signs and symptoms, they are very important for the reason, Sana, if you remember, there was a family that came to us for a diagnosis of their child about 3 years back.
Yeah.
Parent contacted us and a parent contacted us that his son is probably suffering with autism, and they were taking that child to a therapist, which they called a therapist. And the day I saw that therapist, I realized she was a mother. she did just one course from Sunrise program, and then she opened up her institute in Pakistan, and she was charging per session 5,000 rupees, and if she pays you a home visit, she would charge you 60,000 rupees. So she
75,000.
made it a business.
75. One
And
day.
when the child with the family came to us, we told them to stay with us for an hour or so, and we just quietly observed that child. And later I told the father that your child is perfectly normal. The only aspect requiring attention is pay attention to your child, give him some time. That was the only thing the child was requiring. He had not been suffering with autism, speech, or any other aspect. The only aspect was just the attention required was not given to him. So, again, I will say that understanding the problems ourselves, that is of utmost importance.
Yeah, hi. I do agree with you. Um, I'm a doctor myself, and I was part of the team who was making the diagnosis of autism in one of the hospitals in London. And with my child, we got, I think, quite a few things done quickly. We got OT involved, we got speech and language involved from an early age. Um, and I'm not sure about what you guys understand from the services in UK. If I have to say, if I had an option, I would rather better go to Pakistan to get the things done. Okay, so it is really very hard. I am a working mother and I don't have an option of homeschooling. We have to pay the rent of our house. We have to pay for other stuff for our kids, and it's not a possibility. And again, in the wider community, the understanding of autism, even among the parents who are Caucasian, is very different. So they don't want anything done for their child. Okay, so there's so much negativity about doing anything about these kids. So when you say reach out to other parents to get a bigger group so that you can talk to the school, you don't have any idea how much I have done on that. And then at the end you will be left out with your own child. My child has one-to-one support at school, so the teachers should not have any excuse why they can't support it. But his one-to-one has actually no understanding. The OT in this country in NHS has no understanding how a child with autism could be helped. Okay, what they always keep telling me, the speech and language in NHS himself told me, the way my child language was going, we won't change it. He's all in the bottom, he's autistic. So his language will develop in his own way. So it is very different. It's very different. And paying for every single therapy by your own pocket without any help and support is very draining, and you cannot sustain that on the long run. And again, the concepts here are very different. So we are doing as much as a parent we can do at home in the time we have. But it's not like if I'm coming back home from work at 7 p.m., I will wake up my son that no, this is the time I am home. So I think it is very different. And I would I would be very glad if I had a liberty to actually homeschool my child, actually.
Okay. Kindly, Mr. Zahir, you can check your private message from me.
Okay, just coming back to the UK bit again. This is very true what you're saying, okay? But part of it also here is this, with a lot of parents not willing to change, because a lot of them, because of the support system, the financial support system we have in this country, okay, for disability, would be a big loss as a contribution to a lot of families, okay? So if I've had this before, that children can get an intervention, but the parents didn't apply that intervention to the child, because she lose out on the benefits that they were receiving for the child. So if they were shown that the child has shown an improvement, there would be a cut in benefits. So England is a slightly different system. But what you said is this, that if you're a working parent, is not easy. You're working to basically pay the bills here. But in terms of other parents, the reason why you were, I believe you were left, doing the work, the hard work yourself without their support. They talk big, but in the end they drop out, is because they calculate the possible loss financially from the support system for their child if it's shown to show an improvement. And I've had many an example of that in my work, certainly here in England, because there is a support system for them and it's financial. And that finance reduces if you're shown to show an improvement. Hence, a lot of parents start in earnest that, yes, I want to help my child, but then when after a while they drop it because they know a shortfall in the financial income from the fact that the child is disabled. So from the disability point of view, they have a reduction in the income. So there are two ways of looking at this. From my experience, it's that the parents have worked out from a financial point of view. And this is why a lot of parents, again, but is it a cultural thing? I don't know. They all make a big noise, and then when it comes like, talk the talk, and rather than talk the talk and walk the walk, they just do the talk the talk, and the walk doesn't happen. So I can understand exactly your frustration that all the hard work was done, and then end of the day nobody came to support. But in different countries, maybe it might work. So without trying, we can't say that it's not going to work. At least just like you did here, trying, and maybe with the effort of a few, we might find that something can change. If one little thing changes, that might be the start of a snowball effect, and other things along the way might change.
Okay, I was talking about lately, like today somebody came to me and the same question they asked me, that you've got your private institute now and you will ask hell of a money from us. She was a friend and she was a parent as well. So are you listening? Okay. So
sorry, say that again.
I had a friend and she's also a parent. So she asked me that, Sana, you have started your private institution now, and it's an organization and all. So you will be also charging heavily from other people and parents, and it's a business and all that. I must say, while I was only a parent, I never knew how hard it is to run an institution like that, because therapists are expensive. The therapies are expensive. First of all, when the therapists go to get the therapy sessions and they go to the institute and they become therapists, that is expensive. When they come out of that institution, they become therapists, then definitely, like every other person, like a doctor or a teacher or a principal, they also need money to run their home. Then they come to the institute like us. We have to pay them to give the therapies and the assessments, and we need the best therapists in our institute. We need 20, 30 therapists maybe now, but it is really expensive. Now when I became the CEO and director of an institution, and now I know how hard it is without donations, without support of the most important organization, that is government. The government needs to come, forward to help these institutions. Then we need to make strategies to help people. I don't like to ask parents, please, like for example, 10 pounds, 15 pounds, 20 pounds, or euros, or Pakistani rupees, like 2,000, 2,500. Pay that for your child. I don't like it because I know how hard it is with that child. Most expensive child, I must say. The autistic child or with these difficulties. They are the most expensive children. At home, they need computers, they need laptops, they need best clothing because they have sensory issues. Then they have the environment. They need the house, not small, the big one, because they get depressed. This is the expensive task. So we needed to come together in this to help these children. I am doing this because I always tell parents, I'm not helping you. I'm helping that child. I want to help that child because that child is in pain. When that child is in pain, then the parents are in pain because there is no parent who would like to see their children in pain. And I wish that PHSRF one day give free therapies and free assessments and all that, inshallah. But in the start, definitely we need some support, and, to run this business. If people say it's a business.
Thank you, everybody. I've got to go now. So
yeah,
all the best, everybody. And
Mr. Zahir, people
good meeting you.
Yeah, they need your slides. Can we share the slides?
Yes, we can. Yes, we can.
Thank you so much.
Okay.
Thank you so much.
Okay, thank you, Dr. Zahir Ibrahim.
You're very welcome. All the best.
I would like to thank Datu Khadija, especially. I know you from 2011 when Sana came to Malaysia for the first time. We have not conversated, but I know you very well. And she is one of those persons who had been working for the special need cause, not facing a problem herself or in her family, but for the good and benefit of the people. So hats off to you, ma'am. And for Fariha Anjum, just one more aspect I would like to highlight, and that is, if I tie up my hands at my back and somebody asks me to perform a work with my hands, and if I can't deliver, that generates frustration. So any lack of speech or lack of anything, the first byproduct is frustration. Understand the condition of that child. We who call ourselves as normal being, we do require to be pushed up, to be geared up, and we require morale boosting periodically. Have we considered for a single moment that we have tried the same with that special need child, that he requires boosting to perform something that we haven't done?
Okay, Shagufta Sultan, you want to say something? Okay, guys, I've shared the file and you can have this file now.
Sana, I have told every member that along with the e-certificate, we will be sending them the PowerPoint presentation also.
That's good. Okay. Today, right. But still, I have shared it here. And Datu, you have got it here. I love to say that.
I enjoyed myself. Thank you for sharing. And you have done very well. Now from the day that I see you have been doing a lot of work. I should be retiring soon.
Come to Pakistan.
Yeah, Atija, where are you from?
Malaysia.
Malaysia.
Yeah.
Oh.
Yeah, she helped me a lot in Malaysia.
Oh.
Helped me a lot.
And Shazia?
Pardon?
Where are you from?
Shazia?
I'm from Kuala Lumpur. I'm from Kuala Lumpur.
Ah, Kuala Lumpur.
Yes.
Malaysia.
Yes.
Malaysia.
Truly Asia.
Faria Hanum?
From London.
From?
London. She's in London.
I'm in London, but I am from Pakistan originally.
Oh.
And Dr. Khadija, I have seen Munazza didn't speak. She is quite, I don't know. Okay, and Miss Shazia? Miss Shazia, yes.
Shazia Nazim is from Saudi.
Okay.
And as the
She'll
name
go
says,
first.
Munazza, I suppose she's from Bangladesh or Pakistan.
Yes,
The
hi,
name.
Shagufta Sultan.
Shagufta, hello, what are you? ¿Cómo estás?
अस्सलाम वालेकुम।
वालेकुम सलाम।
आपको सुना आवाज आ रही है मेरी?
जी जी बिल्कुल आ रही है, आप प्लीज बोले।
अच्छा, आप लोगों की बहुत अच्छी मीटिंग हो रही है। इट्स अ नाइस प्लेटफॉर्म फॉर एवरी parent who are suffering and who are having special children, and I'm very glad to have you people.
Thank you so much. Thank you. Well, I'm trying it.
Sana, I was saying that, Sana, please also discuss my son's history and case here.
Yeah, you can. Please, you can.
Can I show my
yes,
son?
Yes, why not? It's his show.
What is your baby? What is your I like
It's his show.
I like it to see.
We are here for them. We are here for them. Oh,
oh,
Please help me.
Oh, but
okay.
You are a bigger man now.
This is my son, Abdul Wasi.
Dr. Khatija can help you in this. Dr. Khatija.
Beautiful.
I just want to ask you whether you have got.
Unfortunately, he's very beautiful, but can't talk, can't walk. His milestones are very late. He's 5 years old.
Okay, I must request with Dr. Khatija to talk about your son, please.
Doctor?
Give me.
You were saying, Sana, that
espera. Yes, Doctor.
You say you are starting a home.
Sana, are you talking to me?
No, last time you say you started the home for the people for the society. Have you started it? Is it on? Is the program on?
Which one?
You say you want to start the home.
He says this is the home.
Oh, this is the one. Okay.
Yes, he is from home.
I see.
Autism, also autism.
Office, yes, it's office.
His head is different. He has long head.
Other disease, not on.
Okay, right. Thank you. It's nice meeting and talking to you. I'm due to retire also. I want to concentrate on the other thing was retire. I mean, now it's getting with this rare disease is getting more and more drug involvement and all sort of thing. Yeah, like this one, most of this in your case here, there's no drug involved, isn't it? It's just a matter of having them treated and at home and education. But whereas now we have to look into, I mean, for my case, some of the parents, they have come up with very expensive drugs for the rare disease, but not to cure, it's just to control. Those are the things. Yeah.
No, Datuk, we have also children. Autism is basically behavior that we believe it happens everywhere. It is there in every human being almost, like in any form. But like it have connection with the Down syndrome. It have connection with other diseases. It have connection with cerebral palsy, and it is basically behavior of human being, which is different.
Okay.
So the
Yeah.
thing is that our children are getting drugged, and every
Yeah.
child, I must say, in Pakistan, we have drug abuse here. People don't know much about that. This child should have drugs or not. This child should have drugs or not. You know, we don't have that. So I think the Shagufta child is he becomes in the line of rare disease. I think. What do you say?
Yes, rare disease.
He is in rare disease,
Not,
right?
yes, not all rare disease.
My son, brief history.
Yes, yes, please.
My son is 5 years old. His name is Abdul Wase. Are you getting me?
Yes, yes.
And when he was 2 months old, so he fell down and he had brain injury. So he got two head shunt surgeries. And later on, we came to know that his right side brain is damaged and couldn't grow properly. And due to his milestones are very late, he cannot walk, he cannot talk. His responses are very slow as compared to normal 5-year-old baby. And we have gone to almost every best hospital in the Pakistan, even in Aga Khan Hospital in Karachi, even Shifa International, even in Maroof International, Fauji Foundation, and all best hospitals in Islamabad. And according to the neurosurgeons and neurophysicians, they say that his brain damages cannot be recovered because brain damages have no any replacement. But his rehabilitation is possible.
No, it's okay. Please, you continue. I'm asking
I can
Maria to check. Yes. I'm asking
Okay.
You continue, please.
Okay. So Sana, as far as being parents ourselves is concerned, me and my husband is trying our best to give rehabilitation resources to our son. But as you know, in Pakistan, our rehabilitation programs are not much advanced rather than abroad and rather than Europe. So in my
Even
last
assessments,
visit,
even
sorry?
assessments, diagnosis.
Even they we have, I'm really sorry to say, but we have really poor system of assessment of diagnose. Even doctors
Maria?
didn't guide me.
This is what I said.
Yes, at the time of his injury, doctor misguided us. Doctor didn't treat him well. Doctor didn't diagnose him properly. So we had wasted lot of time running in the doctor's room. So right now I can say that Sana, you and me are suffering on the same state, that your son is also autistic, and you can very well imagine that in Pakistan assessment process is very poor, rehabilitation process is very poor, and unfortunately we don't have institutes here for these type of kids. Like I don't see anything for my son here, because as Priya was saying that physiotherapy is a very long-term process, and you cannot bear the expenses of physiotherapy like according to your pocket. So on this platform, I would like to request to all of you that please suggest me, guide me, and help my son, because according to his neurosurgeon, if I would provide him good rehabilitation, it is possible for him to walk. It is possible for him to live like normal, like up to the mark of like normal babies. Not 100% normal, but can we can try. Like
At
he
least
can
we
be.
can give them a better life.
Yes, at least we
Less
can give him a
pain.
better.
Less pain. We can do something for that.
Shagufta, I would like to add something. That is, first you need to understand that whenever you go to a neurophysician or neuropsychologist, the autism taught during the MBBS, it is just 1 page in 5 years. Uh,
It's an article,
information
a small
pertaining
article in the medical college.
the information pertaining to autism is just 1 page, so you can understand how much knowledge the doctors have. That is first thing. Second, the damage has already been done since he fell. So now you should understand other aspects. One, you go for this therapy.
Yes.
Second, you have to wait, because I have studied that a chip is being prepared which will help the uh, patients having the brain defects or brain
That will
injuries.
be too
For them,
costly, no?
but for them, the chip is under process. There is a chip which is under process. They'll install the chip in the brain to help that child or that person to act normally. So you have to wait for that. These are just two aspects, and these are the realities. Thinking anything over it, that would be too much at this stage. You should understand the country we are living in, where we have shortage of resources, and apart from resources, it is the awareness and knowledge. We don't have that. The government,
You are right.
nobody in the government has that knowledge at all. So since the nobody in the government has the knowledge, how can you expect them to come forward and help people with intellectual disabilities?
You are 100% right.
The only stress they gave in, like I and Sana, we attended a meeting held in the National Assembly, and there were about 35 participants. Out of those 35 participants, we were the only two people who were representing case for intellectual disabilities. Remaining all, they were for the physical disabilities.
They didn't hear a single word.
And nobody was ready to listen to us, including the Speaker of the National Assembly, who was presiding the conference. At the end, he just uttered two words, and that is, I have had a hard day, I am tired, and Dr. Fla Fla Fla,
Yes.
she will take over and she will listen to your problems.
He
Nothing
didn't.
It is
happened.
unfortunate.
So it is a long process. It is a long process. You should understand it will take some time. Till that time, it is us, the parents, the sufferers.
We need
Lest
to
we
do it
do something,
for ourselves.
because it is our problem, it is not their problem. Lest we do something, nothing will happen.
Obviously, I'm sorry to interrupt you, Dr. Saab, because in our last visit to his doctor, his neuro surgeon, he said to us clearly that if you can get a chance to take him abroad, that would be much better rather than living here, because unfortunately, as you said, that our government is not aware. So we don't have government support here for these type of children. We don't have government institutes
Yes.
who are helping us. We don't have any support on any ground.
When a deputy
Even
director, listen, Shagufta, I'm sorry to cut you short, but when a deputy director sitting in front of me, no, sorry, the director of special education sitting in front of me, and she tells me that, oh, Sana, I call them sick people. They will never be able to do something. Oh my God. Just imagine what my feelings will be there. Oh, what is she saying? And the deputy director was telling me, Sana, relax. And I was like,
these type of kids, we are.
if people are on the top of the seats in the government are sitting like these, I don't think so this will happen. So this is what I'm trying to do, that we should make it together, make it happen together. I'm trying to, I would like to ask Dr. Khatija also, that for the rare disease, and for, like, we don't have a rare disease society, Dr. in Pakistan. This child comes in rare disease, right? And he don't have a proper diagnosis still, this child. And Maria Pia, I want to collaborate with you guys over there to bring practice here, bring those, help, that help for these children here. Maria Pia, you also can help her. Like we had, with Oesi Di Maria, Dr. Oesi Di Maria in Italy, Sicilia, is the very best institution over there. It's a rehabilitation center. Maria Pia took me there. We spent 5 days, 1 week, and more. Hannah, Maria Pia, we went there. It's an amazing institution, and it's a research center as well. And I want to make a replica of that center here in Pakistan. So you must go and see that center. Maria Pia also, she can help you out. Maria Pia, her child needs the assessment. Okay, so my organization and your organization can, do something for her. She can.
I'm sorry to interrupt you, Sana, but at least I want his best assessment, because I know doctor said to me that his left brain is complete, and left brain controls, as Dr. Saab also knows, that left brain control IQ level. He can very improve after good rehabilitation, after good diagnosis. In Pakistan, I went in different hospitals, but I'm really sorry to say doctor didn't support me. Same approach,
they
that
don't know,
his brain
actually.
his brain is damaged, so let him, we cannot do anything for him. Only you can pray for him, only dam drood for him, but pray to God.
It is primarily the left and right is conscious and subconscious side of the brain.
Yes.
So,
I would like
the
to
conscious,
ask
the unconscious side, and that is the intellectual side, that is active. But the conscious side, which controls the physical actions
Yes.
and normal routine affairs, that is damaged.
Yes.
So,
sorry, we are running out of time. Dr. Khatija, would you say something about it? That we have these problems here in Pakistan, you see?
Well, definitely, because different country has different priorities and all that sort of thing. Like we are here in Malaysia, we are lucky in the sense that when it's come to medical, when you get treatment in the government hospital, it's all for free, and our expertise is always on the increase, improvement and all that. But when it comes to rare disease, for us, this is my issue here. But other than that, the rare disease, there are some with treatment, there are some without treatment. There are some treatment, rare disease, where they need 500,000 a year. That the government is paying for those cases, if there is hope, if they can improve. But the issue is that now it all depends on the country's capacity, capability. So recently, with this recent problem, they are looking into the patient going to get to be contributing towards the cause. So we are again waiting for something to, if possible, to avoid that, because the rare disease is getting more and more expensive, and is coming up very, being discovered with the rare disease. But still within that rare disease, we are having all this like autism, we have all these cases and all that. We have association, we are looking into it, because these are some of these patients, they have multiple disabilities.
Just talk a little bit about what exactly autism is. Autism is a very big continuum that goes from very severe to Chinese nonverbal, all the way up to scientists and engineers. And I actually feel at home here because of autism genetics here.
Pia, your video sound.
Just.
Okay. Yes, Doctor.
So we are also hoping that, things don't change, because now more and more rare diseases are being discovered, but there's no drugs. There are new drugs are being discovered, and the pharma companies will be just charging and all those sort of things. So we are keeping our fingers crossed. We hope that the situation will not be so drastic in the next coming years. We're looking forward to it. So must congratulate you, Sana, for making this possible in Pakistan. All your endeavors and all that sort of thing.
Because of you.
You're helping the yeah. We'll assist. I'll get our societies here to help work out with you all, in this autism, because they are also coming with programs and that sort of thing. Maybe you can share. We share with it with them. Yeah. Okay. I also will be looking into retirement, but I will be helping out the other way, not to directly, but because I'm going in my late 70s, so I should be resting.
You should. I've seen you working, and you were working just like machines, non-stop. That was amazing. Mashallah, mashallah. So,
We will support you in our ways, in whatever ways I can. Yeah. Okay. All the best. Congratulations for this.
Congratulations, Sana.
Thank you so much.
Thank you for this, and I hope
for providing us this platform.
Yeah.
Tell me what happened.
Maria Pia, what happened?
Who?
Okay. Something happened.
Oh, right, Coco. My
Okay.
family.
Okay, Maria Pia, what if Shagufta can pay the OSC the Maria for 1 month or whatever in assessments? So we can send her, for the assessments, or therapies and assessments.
With Elia?
For the test.
With Elia?
To Cecilia.
With Elia?
Dr. Elia, yes.
Sana, write one email.
Okay.
With the uses, for child, give me email and Elia.
Yes, I would send her email. For my understanding, she's asking for email. Okay.
Give me one email. Me and Dr. Elia, okay? When can use this, what's the name of baby? Come si chiama il bambino?
Abdul Wasi.
Abdullah.
Abdul Wasi.
Okay, grazie.
Yeah.
Okay? Maybe, Sana, sorry, but there's a problem. It's government for recovery.
Yeah, our government is not helping. I'm trying to get them. Soon I'm gonna inaugurate this Casa Autismo. I'll inaugurate it, and I'll be bringing some ministers, for inauguration, and then to bring them again and again, and I'll show them that this is what we are doing. But it will take a bit time, She said, I will pay for my child, her company or something.
And so I will provide them each other supporting documents again.
Insurance.
No,
she's telling you something. Yes,
yes, I was saying that I would provide her every supporting document regarding my son, his medical reports, and his disability certificate, which, as you know, government provide us for our children.
And she's actually trying to say that government should support you because it's expensive,
Yes.
You will be the private patient.
As you told me, Sana, yes, as you told me, Sana, that if she would charge us, so I would try to pay privately, because for my son I would have to do.
Yes, this is what Dr. Elia and Dr. Bono told me as well. that
but because of
privately
your
that is.
reference and NGO, we would try to
So we can only do
to
this.
be lenient with us.
Make your documents. We can refer you to that center, right? And we will be asking the embassy for to help you out. And this is genuine case, definitely. And your son needs help. So
Yes.
we can do that, yes. Maria?
Yes.
Sana, yes, I write my email address.
Okay.
Shagufta
Yes,
Sultan.
I have got her email ID, and I would write email in detail.
Yes, yes, you give email at me and Sana together. Okay. After I give Dr. Elia email with the documents.
Okay.
She's saying that I will send it to Dr. Elia in Sicily, right? The OIC de Maria. I'll also share the Dr. Khatija also for you. I think I've shared with you OIC de Maria.
But your child autism, but other issues.
No autism, no autism. I think autism.
He has not autism.
No.
Autistic nahi hai. He is not autistic. He has brain issues.
Brain
Dr.
issues.
Khatija, what do you say?
Surgery.
Yes, he had surgery. Yes, he had surgeries.
He had surgery, and Dr. Khatija, he fell down, and he had a brain injury.
For what? For what surgery? What injury in brain?
He had brain injury. He had hygroma, hydrocephalus.
Okay. I know autism. Okay. So is hyperactivity now? Hyperactivity?
Hyperactive hota hai? No, I don't think so. Hota hai?
Yes. Mary, just wait a minute. I can show you. I can show.
She will show.
Like he is sitting now. Abdul Wase.
Dr. Khatija works with physical disabilities.
Okay.
Abdul Wase, say hi. His responses are not as much good as it should be.
He can understand.
Abdul Wase.
Abdullah.
Wase.
Ciao, amore, ciao.
Understand, yes.
Bravo.
Now he's giving response.
Look at me, Abdullah. Look at me.
Look at auntie.
Amore, come stai? What are you? It's fine.
He's 5.
It's fine.
He is 5 years old.
Yes. No, tell me. You speak. Speak, please. Abdullah, talk with me.
Abdul Wase. He can himself.
Abdul Wase.
Abdullah did ciao.
Abdul Wase.
Ciao. Hello, ciao.
Can he walk? No.
Ciao.
No, he cannot stand and he cannot walk.
Ciao. Amore. With your hand. Ciao. Oh, your brother. Ciao.
Yes.
Ciao. Nice.
Oh, straight, right?
Sun face.
No, I'm reading the report here.
Mary, his responses are not as much good.
Ciao.
But he can understand. Yes.
Talk with me. You say ciao. Hello.
Abdul Wase.
Ciao. Oh, you understand?